What's going on, world? Welcome, welcome, welcome. Hey, today, you already know what the deal is. You already know what we're doing today. We're doing NCLEX questions. Anybody ever had a Mamba? You already had these before? Hey, they're pretty good. Anyways, what's up? How y'all doing? We're going to be doing NCLEX questions today, but I'm going to let for everybody trickle in here so we can see what's going on. That's right. That's right. That's right. Welcome, welcome, welcome. Hey, if you guys are new here, I want to know who you are, where you're from, and where you're at in your nursing journey. I probably shouldn't have ate that Mamba because now I'm over here smacking like I ain't got no damn home training. But welcome. Make sure you guys like, share, follow the stream. Hey, we got some questions here today. You already know we got some NCLEX questions. Hey, what's up? Happy mom. I know that you say you had a bunch of stuff going on, so hopefully you've had a good week so far. But as you guys start trickling in, I want to know who you are, where you're from, where you're at in your nursing journey. We're going to be doing nursing questions, NCLEX questions today. Y'all know how it goes. Is it a Karim? Thank you. Hey, how are you? Hey, so like I said, hey, once we get 100 people up in here, you already know it's going to be on and popping. You already know what we're going to do. You already know what I'm about. I'm waiting to ban somebody today because, you know, people come in here and they try to test me all the time. But hey, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. We're going to be doing NCLEX questions, but I want to know who you are. If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. I may have to cut the stream short, but we'll see. Are you going to do shirts with your quotes on them? I am actually, not to say that. Like, I have a couple of shirts that are in mind right now. What's up, Steph? I have a couple of shirts that are in mind right now that I am going to put my quotes on. It's coming. It's coming. Hey, remember, I'm a one-man army trying to do all this stuff essentially kind of by myself. But, you know, we're going to make some stuff work. So, hey, so shout out to all 40 plus of y'all in here, 50 plus of y'all in here. We're doing NCLEX questions. So make sure you guys like, share, follow. OK, like, share, follow. I only got one like on here. That is rude. And there's 60 plus people in here. Hey, we're going to be doing NCLEX questions. The more likes that you guys give me, the more. It says dog country. What you mean? What you mean, Amy? What you mean? I was like, what? What happened? What'd I do? What'd I do? But anyways, hey, so like I said, make sure you guys smash that like button. Make sure you guys like, make sure you guys share, make sure you guys follow. We're going to do NCLEX questions. I want to know how you guys' week has gone so far. Hey, we got 120 something people in here. You already know that we do housekeeping, right? Housekeeping stuff first, and then we're going to roll into it. All right. So here we go. Let me turn this thing around so you guys don't have to look at my hideous face. Money. There it is. All right, y'all. Here we go. First of all, welcome. We're going to be doing NCLEX questions. Participate. That is the key. Participation is the key. Make sure it happens. All right. Like, share, follow. Give me all them likes. Don't be selfish your whole life. Also, if you troll my chat, I'm going to ban you. I'm just letting you know. I wish you did Hesse. Look, I don't do Hesse. All right. I don't do Hesse when I was in school, and I damn sure don't do Hesse now. But it says, I'm a little tired. Sorry. Let's go. Hey, let's make it happen. So also, I got these questions off nurseslabs.com. 7-day NCLEX course, $48. It is going away. Hey, also, my new generation NCLEX course is completely up. All right. And it's 8 videos, right? Breaking up 100 questions plus some tips at the beginning and at the end. All right. So make sure you guys go over there and check that out. $48. It's not a scam. It's not a game. It's not a joke. Ask people because there's a bunch of people in here that have it and they like it so far. I've had really good positive feedback. OK. Also, if you're looking for one-on-one coaching, you guys can go check that out at bootnurse.com/coaching. And we're going to do an Ask Me Anything after this. All right. So without further ado, let us jump into it. All right, y'all. Here we go. Oh, I'm going to put y'all on a timer, too. Here we go, because y'all be taking too long. Here we go. Question number 1. Mrs. Chua, a 78-year-old client, is admitted with a diagnosis of mild chronic heart failure. The nurse expects to hear when listening to the client's lungs indicative of chronic heart failure would be what? Stridor, crackles, wheezing, or friction rub. What are we thinking? Shout out to all 200 of y'all that are in here. We take too long. Hey, you want to get banned? Steph, you want to get banned? Don't do that. You about to get banned. You know better. You've been here long enough that I ban people for no reason. But, all right, we've got people saying B. All right, cool. Is it Austin? Appreciate the follow. Thank you. All right, y'all. We got A. Okay. Is Isha Bounty. What's up? How are you? Adriana. And is it Kendall? Thank you for the follow. Who said, Carolina, how are you? I'm good. I'm good. How are you? Don't do that to me. I ain't gonna do you like that. All right, y'all. Here we go. Here's our answer. Well, first of all, let me make sure it's on there right. Okay, here's our answer, y'all. Here's our answer in 3, 2. Normie, thank you for the follow. And the answer is B. It's crackles. Left-sided heart failure causes fluid accumulation in the capillary network of the lungs. Fluid eventually enters alveolar spaces and causes crackling sounds at the end of inspiration. Pulmonary edema may cause crackling sounds in the lungs. People with congestive heart failure often have pulmonary edema. CHF occurs when the heart cannot pump blood effectively. This results in a backup of blood, which increases blood pressure and causes fluid to collect in the air sacs in the lungs. That is part of health promotions and maintenance. Okay. The case studies took me out. What you mean? Why? The case studies are actually pretty good. I like them. Hindsight's 2020 though. I can only say that because I've been a nurse for a little bit now. So, well, welcome everybody. We're doing NCLEX questions. Make sure you guys like, share, follow. Question number 2. Patrick, who is hospitalized following a myocardial infarction. Somebody said they like the word infarction and something's wrong with you. Asked the nurse why he is taking morphine. The nurse explains that morphine does. What does morphine do? Does it decrease anxiety and restlessness, prevents shock and relieves pain, dilates coronary blood vessels, or helps prevent fibrillation of the heart? Let's see. I have my cardiac exam tomorrow. Any tips? Stay for the live. But your cardiac exam, I already know how your blood flow, know how the heart works, know how the blood flow works, right? Also think about those cardiac medications, your inotropic, your chronotropic, preload, afterload, blood pressure, safety indications, all that good jazz. All right, y'all. Hey, shout out to everybody. Hey, I got these questions off nurseslabs.com. They got their free sets of questions. You guys can go over there and check those out. Dog Mama, appreciate the follow. Thank you. All right, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is B, prevents shock and relieves pain. Morphine is a central nervous system depressant used to relieve the pain associated with myocardial infarction. It also decreases apprehension and prevents cardiogenic shock. FDA-approved usage of morphine sulfate includes moderate to severe pain that may be acute or chronic. Most commonly used in pain management, morphine provides major relief to patients inflicted with pain, and that's what it does. All right. So pharmacological and parenteral therapies. Hey, so one of the biggest things that you guys need to realize is when you guys are studying, you guys study the rationales. You have to do it. You have to know why this question is correct. Also, you have to know why these were not the correct answers. Okay. All right, y'all. Appreciate there's like 5 or 6 people that just followed. I appreciate y'all. What else we got? Here we go. Question number 3. Which of the following should the nurse teach the client about the signs of digitalis toxicity? Increased appetite, elevated blood pressure, skin rash over the chest and back, or visual disturbances such as seeing yellow spots? What are we thinking? Hey, if you guys are new here, also, I want to know who you are, where you're from, and where you're at in your nursing journey. Also, make sure you guys smash that like button. Make sure you guys share and you guys follow because you guys aren't selfish. I mean, some of y'all are in here are selfish and that's apparent, but not all y'all. You know what I'm saying? So y'all go ahead and y'all share it. What are we thinking? Okay. All right. Got everybody screaming D. You're nice. All right, Kareem, I appreciate you. Do you say, who said that? Said, is it Amina? Do you say rude? You said rube or rude? I'm assuming you said rude. Wait, somebody says, taking my NCLEX tomorrow morning. Lori, I need for you to go away then. Get off my live. Get off my live because you don't need to be here. You need to be relaxing and not looking at anything NCLEX related. All right, here we go, y'all. Here's our answer in 3, 2. And our answer is D, visual disturbances such as seeing yellow spots. Seeing yellow spots and colored vision are common symptoms of digitalis toxicity. Of note, visual changes, especially changes involving color, such as seeing a yellow hue, are better known and specifically seen in digitalis toxicity. Other visual problems include photophobia, photopsia, and a diminished visual acuity. Also part of pharmacological and parenteral therapies. So whoever that was, I told to leave. I forgot what your name was already. The reason why I say that is because you don't really, if you've been studying correctly, like the way you should have been, you don't need to be here. You need to be relaxing as much as possible. I know that's better said than done. But if you don't know it by now, you don't know it at all. Remember, it's all about making yourself familiar. Okay, here we go. Question number 4. Nurse Trisha teaches a client with heart failure to take oral furosemide in the morning. The reason is to help for what? It's This is a retard rapid drug absorption, excrete excessive fluids accumulated at night, prevent sleep disturbances during the night, or prevention of electrolyte imbalances. All right, what are we thinking? What are we thinking? Hey, also, nobody answered my question. I want to know who you are, where you're from, where you're at in your nursing journey. Also, if you're not a nurse, what you doing here? You know, I'm always curious to know. I'm always curious. I took my NCLEX on Monday and passed. BTS, a shout out to you. Congratulations to everybody right now. Give BTS their love. Tell them tell he or she congratulations. Hi, FSCJ. Oh, I went to that school. I did some prereqs there. Graduated in May. Shout out to you. Congratulations to BTS for getting through that exam, and welcome you to the greatest shit show on earth, also known as nursing. All right, so welcome. Not a nurse, just love to learn. All right, Angela, I see you out there. Grenada, or is it Grenada? I think it's Grenada. So shout out to you for being here. All right, y'all, here we go. Here's our answer in 3, 2, and the answer is C. It prevents sleep disturbances during the night. When diuretics are taken in the morning, the client will void frequently during daytime and will not need to void frequently at night. Normally, when an individual receives furosemide either orally or intravenously, it increases sodium excretion in urine. In a patient with extracellular volume expansion who has never had exposure to furosemide, the first dose of the drug causes significant sodium excretion and diuresis within the first 3 to 6 hours. Look, I've literally seen furosemide work like within 5 to 10 minutes. I'm just like, wow, just pushing it all the way through. Hey, pharmacology, parenteral therapies. It is the second largest section on the NCLEX. Okay. Second largest, and it says decreases falls in the elderly at night. Yup. Pharmacology folks always here. Look, or pharmacy folks. I love the pharmacy folks always being in here, right? Hey, but it's the second largest section on the NCLEX. Doesn't matter if it's the LPN or the RN. This is awesome. Is it caramel? Caramel. I appreciate you. Thank you. I'm just a bored pharmacy tech watching. That's all right. We about to unboard you though. Here we go. Question number 5. What would be the primary goal of therapy for a client with pulmonary edema and heart failure? Enhance comfort, increase cardiac output, improve respiratory status, or peripheral edema decreased. Says, I'm a director of dementia care and now retired. Shout out to you, Kansas. Shout out to you. Hey, make sure you guys keep smashing that like button. You guys share and you guys follow. Hey, get it out to people that may need this. All right. Get it out to people. All right. Steph is screaming C at me. Steph, what'd I tell you about yelling at me? Alabama, Roll Tide. Just kidding. I'm getting ready for my NCLEX and I lost focus. I'm so discouraged since I failed once. Ma'am, hey, I'm going to tell you right now. I don't care that you failed. I failed 3 times. I failed 3 times. And let me reiterate, not me saying that I don't care. I mean, I don't. But my next question is, what are you going to do about it? You're discouraged. So what are you going to do to fix it? I failed 3 times. So what are you going to do to fix it? That's nothing but love. I promise. I promise it's nothing but love. So here we go. Here's our answer since somebody is telling me since somebody's rushing me. But here we go in 3, 2. And the answer is B, increased cardiac output. The primary goal of therapy for the client with pulmonary edema or heart failure is increased cardiac output. Pulmonary edema is an acute medical emergency requiring immediate intervention. A preload reduction decreases pulmonary capillary hydrostatic pressure and reduces fluid transitation into the pulmonary interstitium and alveoli. Afterload reduction increases cardiac output and improves renal perfusion, which allows for diuresis in the patient with fluid overload. That is part of physiological adaptation. The third largest section on the NCLEX at 11 to 17%, 14 to 17%. Hey, some places will say a little bit different, but NCSBN says 11 to 17. Okay. So make sure you guys understand that. You read your rationales. You have to read them. Hey, you need content, you need Q&A, and you need to read your rationales. That's the trifecta of things that you need. All right. In order for you to be super successful on this exam. All right. Hey, break time real quick. Don't y'all go nowhere because I know y'all be trying to leave after y'all get all this free shit. Here we go. Participate. That's the key. I'm kind of funny sometimes. Hey, and if you come into my chat and you rush me, I'm going to ban you. And if you come in here and roast me, I'm going to roast you back. But that's love, baby. I promise. Hey, make sure you guys share, follow, give me all them likes. Don't be selfish your whole life. You troll my chat, I'm going to ban you. Rachel said I got a 96 on my exam. Shout out to Rachel. Shout out to you, Rachel. Also, yeah, if you come in here, I'm gonna ban you. It literally says I'm gonna ban that ass. So don't be that guy or gal. All right. Nurseslabs.com is where I got these questions from. You guys can go over there and check that out for yourself. 7-day NCLEX course. It's $48, y'all, and y'all get it for a lifetime. That is going away on next Thursday. It's going away. If you go and look on Friday, I promise you it won't be there. All right. What is it? If you need coaching 1-on-1 for NCLEX, you can check me out at thebootinurse.com/coaching. And we're going to do an Ask Me Anything after this as well. So whatever questions you guys have, hopefully I'll be able to answer them. All right. And you guys can go check all those links out in my bio. Okay. All of them in my, the program as well as the coaching. They're the first 2 tabs. Okay. Here we go. Question number 6. Nurse Linda is caring for a client with head injury and monitoring the client for decrepit posturing. Which of the following is a characteristic of this type of posturing? Is it upper extremity flexion and lower extremity flexion? Upper extremity flexion with lower extremity extension of the extremities after a stimulus, or flexion of the extremities after a stimulus? What are we thinking? I never want to take the NCLEX again. I cried the whole way home after my LPN exam. But you a LPN though, right? I mean, you're a nurse now, right? Steph says, oh hell. The cerebrit, there it is. What did I say? Decrepibrit? I stay messing words up. Hey, do I look like a 10-year-old getting ready for a spelling bee? Sorry if you guys hear my son. Y'all already know, if you guys come here enough, the co-host, he jumps in. So I said cerebrit. Yeah, I did. I said something. It's fate that it pops up on my FY, and I just got home from clinical. Is it Kyla? Shout out to you. Kevin, I'm a nursing student first semester, and I'm fighting my way through. First semester of nursing school, that's the humbling phase. That ass is getting humbled real quick, and it does that to you, and that's okay. Every nursing student, every nurse that's in here has gone through it. All right, y'all, here we go. Here's our answer in 3, 2, and the answer is C, extension of the extremities after a stimulus, right? Decerebrate posturing is the extension of the extremities after a stimulus, which may occur with the upper brain stem injury. Decerebrate posturing is described as adduction and internal rotation of the shoulder, extension at the elbows with pronation of the forearm, and flexion of the fingers. That is physiological adaptation. Hey, 3rd largest section on the NCLEX. Here's one thing. If you guys cannot visualize that in your head, nothing that a Google picture won't show you, I promise. And there's nothing wrong with looking at Google when you guys are trying to learn something, or if it's inside your book. I can tell you right now, I worked the ICU, I worked PACU, and I worked OR, and there's plenty of times where I'm just like, man, I don't remember what that looks like. Or man, I don't remember that drug. Let me see it. All right. There's nothing wrong with y'all doing that. And don't feel ashamed to do it either. And if anybody else makes you feel ashamed, you can just tell them to go fuck themselves. Anyways, here we go. Question number 7. A female client taking, is it Cascara Sagrada? Sure, whatever. Nurse Betty informs the client that the following may be experienced as a side effect of this medication: GI bleeding, peptic ulcer disease, abdominal cramping, or partial bowel obstruction. I know they're going to put how to spell it down there in the chat. So did I say sangria? Hey, look, boats and hoes. You know what I'm saying? Katie Davis, look, I wish I could tell you. I've never seen that before. I'm not even going to lie to you. And if I did see it, I probably saw it at first semester of nursing school and didn't care. Got my dosage calculations and fundamentals tomorrow. Bella, you going to be all right out there. You going to be all right. Never heard of that. And I'm a CRNA. See, look, even the advanced practice nurse doesn't know. Yeah, there you go. All right, y'all, 10 seconds. Hey, if you guys are new here, we got these questions off nurseslabs.com. These conversations are taking me out. Bella, look, or conversions, or you say conversations? Obviously, conversions. I got you. All right, y'all, here we go. Here's our answer. In what the hell? 3, 2. And the answer is C, abdominal cramp. Hey, look at that. Sorry. If you guys can still see that, I don't know what happened. My phone started slipping. But the most frequent side effect of, it's a laxative. Okay. Is abdominal cramping and nausea. Is possibly safe for adults when taken for less than 1 week. Side effects include stomach discomfort and cramps. That is pharmacology. The good old pharmacology that everybody in here loves so much. All right. 2nd largest section on the NCLEX, y'all. All right. It says I'm from the Outlander. Oh, okay. Gotcha. All right, y'all. Here we go. Question number 8. Dr. Marquez orders a continuous intravenous nitroglycerin infusion for a client suffering from a myocardial infarction. Which of the following is the best essential nursing action? Is it A, monitoring urine output frequently, B, monitoring blood pressure every 4 hours, C, obtaining serum potassium levels daily, or is it D, obtaining infusion pump for the medication? Take Farm next week. I'm so scared. Hey, Farm is a monster. Farm is a monster. Hey, so what's the key word in this sentence? What's the key word? All right. And think about nitroglycerin, right? How would I want it's being administered intravenously, right? So what is the most essential thing, right? There you go. Keyword is most. Nitro is another one, right? There are keywords. So, hey, they're getting nitroglycerin because they're suffering from an MI, right? So what is the most essential thing? Like if I could do one thing and leave, what would it be that would keep my patient safe? Okay. B, bottom out. Okay. Yep. I like where your head is at. All right, y'all, here we go. Here's our answer. In 3, 2. And the answer is D, obtaining infusion pump for the medication. Administration of IV nitroglycerin infusion requires a pump for accurate control of the medication. There are IV routes of administration for nitroglycerin used most commonly in emergency rooms and ICUs. It is administered with a 5% dextrose of water drip, and it is indicated when sublingual nitroglycerin has failed to provide symptomatic relief, or if rapid and continued relief of symptoms is necessary. When administered, its effects require tight monitoring as discussed below. And so yes, blood pressure, obviously it's going to lower my blood pressure. It's going to lower all kinds of stuff, right? But the biggest thing is kind of like potassium. We don't ever push potassium IV, right? Potassium has to be on an IV pump, right? It has to be on an IV pump. So I can't just willy-nilly start opening up a bolus nitroglycerin. I'm going to kill somebody. Okay, this is why it's important to read the rationales. Bella said, I love the rationales. Look, let me tell you, some of these rationales don't be hitting on shit. But I'm going to tell you right now, potassium push makes me see Jesus. Yeah, it make you and everyone else see Jesus too. So that's why it's important with nitroglycerin. It has to be on an IV pump. With these cardiac meds and a lot of these other meds that can really mess with your heart, you definitely want to make sure that they're on an IV pump. Okay, here we go. Question number 9. During the second day of hospitalization of a client after a myocardial infarction, which of the following is an expected outcome? So what do we want to see? What is supposed to happen, right? Is it A, able to perform self-care activities without pain? B, severe chest pain, can recognize risk factors of a myocardial infarction, or can participate in a cardiac rehabilitation walking program? What are we looking at? Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys like, share, and follow, right? Like this live and share this live and follow, because you're not greedy. Like, you're awesome. You're a great, awesome person. Okay. Also, I want to know who you are, where you're from, where you were at in your nursing journey. All right. This is how we participate with one another. And if you're not a nurse, what you doing? I heard a bored pharmacy tech that was in here, so I want to see who else is bored. I want them to be able to. Okay. All right. Is it Abigail? Abby? All right, y'all. Here we go. Here's our answer in 3, 2, paramedic, shout out to you. And the answer is A, able to perform self-care activities without pain. On the second day of hospitalization after suffering a myocardial infarction, clients are able to perform care without chest pain. Instruct the patient to report any pain immediately. Provide a quiet environment, calm activities, and comfort measures. What does it say? Approach the patient calmly and confidently. Decrease external stimuli, which may aggravate anxiety and cardiac strain. Limit coping activities and adjust to the current situation. That is physiological adaptation. Third largest section on the NCLEX at 11 to 17%. Okay, remember, you have to read these. Right? That's how you retain the information. I remember I had a heart patient and we were going to play Connect 4, and then I get real competitive. And so I was like, hey, we can't play this no more because you may not make it. So, but yo, I'm just letting y'all know. Here we go. Question number 10. A 68-year-old client is diagnosed with a right-sided brain attack and is admitted to the hospital. In caring for this client, the nurse should plan to what? Is it application of elastic stockings to prevent flaccid by muscle? Is it use hand roll and extend the left upper extremity on a pillow to prevent contractions. Use a bed cradle to prevent dorsal flexion of the feet, or do range of motion or do passive range of motion exercises. What are we thinking? What are we thinking? Hey, make sure you guys keep smashing that like button. If you guys are new here, we're doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys like. Make sure you guys share it to your fellow nurses, nursing students, mechanical engineers, whoever wants to sit here and be a part of this, I guess. Also, I want to know who you are, where you're from, where you're at in your nursing journey. Hey, also, I do one-on-one coaching, and this is exactly what I do when I break down questions. So if that's something that you're looking for, those links are in my bio. What are we thinking? Why would it be a bad thing? Dorsal flexion. Why would it be a bad thing? You ever heard of drop foot? All right, here we go. Here we go, because Cali difficult to get. Okay, I got you. EKG tech, because okay. Retired hospital corpsman with BSN. Shout out to you. Is it LC? Hey, man, I'm a corpsman, so shout out to you, man. I ain't retired, though. I'm still in. Here we go. And the answer is B. Use hand roll and extend the left upper extremity of the pillow to prevent contractions. All right, now let's read this rationale. I know that's kind of small for some of y'all to see. The left side of the body will be affected in a right-sided brain attack. Begin active or passive range of motion to all extremities on admission. Encourage exercises such as quadricep and glute exercises, squeezing a rubber ball, extension of the fingers and legs and feet. Minimize muscle atrophy. Promote circulation. Helps prevent contractures. Reduces risk of hypercalciuria and osteoporosis if the underlying problem is hemorrhage. That is basic care and comfort. One of the smaller sections on the NCLEX at 6 to 12%. Okay. So, hey, make sure you guys read your rationales. Also, there's nothing wrong with you guys going outside and doing a little bit more research when you're trying to understand a disease process, okay? But the one thing I will say is that when you guys are studying, don't start using like 5 or 6 different resources, okay? Because they're all going to say something different, and sometimes they're all going to contradict themselves. Manager at Walmart, but I want to be a nurse. Hey, shout out to Walmart, I guess. Whatever. Here we go. Break time. Doing NCLEX questions. You guys know where I got them from. I got them off nurseslabs.com. You guys can go over there and check those out. What unit do you work, Kevin? I worked on the ICU for a year, specifically a burn ICU, a neuro, and a medical ICU. And then I worked PACU, and now I do OR. So make sure you guys participate. That was a good question, by the way. Share, follow, like. I want them all because you're not greedy. If you act a fool on my chat, I'm going to ban you. Hey, also, if you rush me, I'm going to ban you too. Because that's just rude. That's just like if I'm in front of a class and you're just like, hey, can you hurry the fuck up and go to the next subject? I'm like, hey, bro, I got something for you. But that's love, baby. I'm just saying. Nurseslab.com, 7-day NCLEX course. That is my NCLEX course I created. The new generation NCLEX review is up, all 8 videos. All right. And it is going away. That price is going away on the 23rd. I'm just letting y'all know right now. Also, if you're looking for tutoring, that link is also in my bio. And I'm going to do an Ask Me Anything after this. All right. All those links are in my bio. What did you say? Somebody said, did you like the neuro ICU? Neuro was cool. You're awesome helping other nurses. Who said that? Janny, look, I love doing this. I enjoy this a lot. Question number 11, Nurse Liza or Lisa or Liza, whatever, Lizzo, is assigned to care for a client who has returned to the nursing unit after a left nephrectomy. Nurse Liza's highest priority would be what? Hourly urine output, temperature, able to turn side to side, or able to sip clear liquids. I just took a DNA test. Turns out they took my left kidney. I don't know what to do. All right, I'm done. 15 seconds. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Make sure you guys smash that like button. You guys share. You guys follow. I see some familiar names in here. Elizabeth said you're funny. Kinda. Sometimes I'm sassy, apparently. Not really a word that I have in my vocabulary, but, you know, I got mostly women here, so that's what they tell me. All right, y'all, here we go, y'all. Here's our answer in 3, 2. It says, what a planet, and match. Appreciate the follow. And the answer is hourly urine outputs. After a nephrectomy, it is necessary to measure urine output hourly. This is done to assess the effectiveness of the remaining kidney, also to detect renal failure early. Immediately after surgery, the healthcare team will carefully watch the client's blood pressure, electrolytes, and fluid balance. These body functions are controlled in part by the kidneys. The client will most likely have a urinary catheter in the bladder for a short time during the recovery. That is a reduction of risk potential, anywhere between 6 to 9 to 12%. So we'll say 9 to 12% if I remember right? So it is most definitely important that you monitor that urinary output, right? Because that's one of the most important things that we need to know, because that's going to tell us really quick if stuff is not working, right? And the kidneys, I'm trying to tell y'all, the kidneys they run everything. And if one organ starts to fall, the other ones start to compensate, but then they start doing the kidney's job, and then the rest of the organs start to fall. All right. So that's why it's super important. Right, here we go. Question number 12. A 64-year-old male client with a long history of cardiovascular problems, including hypertension and angina, is to be scheduled for a cardiac catheterization. During pre-cardiac catheterization teaching, Nurse Cherry should inform the client that the primary purpose of the procedure is to what? To determine the existence of CHD, to visualize the decrease or disease process in the coronary arteries. My goodness, I can't talk today. To obtain the heart chamber's pressure, or to measure oxygen content of different heart chambers. I had a nurse on my floor whose name was Apple. She a stripper or what? Nurse Cherry, Nurse Apple. I'm telling you, those are OnlyFans names that they're putting on name tags while they're walking on the floor. Yeah, I said it. First, you thought it was C. That's why it's important for you to read the question. Have to run, but be strong. All right, Elsie, I see you out there. I see you. C or D. Fallon says C or D. You got to give me one. Lola, what's a pig? I don't know. What's that mean? Jessica says B. Okay. Is this a bean? Thank you for the follow. All right, y'all. Here we go. Here is our answer. In 3, 2, and the answer is B, to visualize the disease process of the coronary arteries. The lumen of the arteries can be assessed by cardiac catheterization. Angina is usually caused by narrowing of the coronary arteries. Left heart catheterization has a diagnostic as well as a therapeutic role. Although it is used for cardiac hemodynamics and assessment of the valvular lesions, its main diagnostic role is the assessment of the coronary artery disease. In the contemporary era, left heart catheterization, especially selective coronary angiogram, is considered the gold standard test for coronary artery disease diagnosis. That is part of physiological adaptation, the third largest section on the NCLEX. Thank you for teaching and reminding us. I got you, Jill. I got you. This is why I like doing this. This is why I really do truly enjoy doing this. I've been an instructor in the Navy for the last 8 years. I taught in a bunch of other programs, and I'm also a trauma nurse instructor. So I really love enjoying teaching. So I love this a lot. Here we go. Question number 13. During the first several hours after a cardiac catheterization, it would be most essential for Nurse Cherry to drop her OnlyFans link. I'm just playing. To drop. Oh, shit. Elevate the client's bed 45 degrees. Instruct the client to cough and deep breathe every 2 hours. Frequently monitor the client's apical pulse and blood pressure, or monitor client's temperature every hour. Hello, Kevin and everyone. What's up? How are you? All right, y'all. I'm going to give y'all 20 seconds to answer this one. We got some C's. We got some D's. Looks like mostly C and D. That's getting answered. Hey, if you guys are new here, I want to know who you are, where you're from, and where you're at in your nursing journey. Also, I need everybody smashing that like button. I need everybody to like and share and follow. All right. I need 10,000 likes, y'all. I need 10,000 likes right now. Is it Fanta? Don't you wanna Fanta? I'm sorry. You're a student. Welcome. Please don't be mad at me that I just did that. Oh, man. Studying for NCLEX. Shout out to you. I meant C. Okay. All right, Jill, I see you. Nursing grad. Okay. LPN, long-term care. Okay. Long-term care. All right. Here we go, y'all. Here's our answer. LVN and LA. All right. Here we go in 3, 2, and the answer is C. Frequently monitor the client's apical pulse, and blood pressure. Blood pressure is monitored to detect hypotension, which may indicate shock or hemorrhage. The apical pulse is taken to detect arrhythmias related to cardiac irritability. During the procedure, a nurse is assigned to monitor vital signs. After the procedure, the nurse is also responsible for ensuring that the access site is not bleeding and the distal extremity pulses are intact. That is reduction of risk potential. Hey, that is super important when they're doing ablations or they're doing any type of in the cath lab. That's huge. Bleeding risks. All right. Let you pay attention. Hey, RTFQ. Who knows what RTFQ means? Go ahead and say it down in the chat. I want to know. Who knows what it means? Because that's what I'm trying to tell y'all. Hey, people get it wrong because they don't read the question all the way. I'm just letting y'all know. RTFQ. All right, here we go. Question number 14. Kate, who has undergone a mitral valve replacement, suddenly experiences a continuous bleeding from the surgical site during the post-operative period. Which of the following pharmacological agents should Nurse Isa prepare to administer to Kate? Is it protamine sulfate? Is it quinidine sulfate? Vitamin C or Coumadin? Read the effing question. Y'all already know what the deal is, baby. Y'all know what the deal is. Read the question, right? Read it. Hey, shout out to all 200 plus of y'all. We're doing NCLEX questions. I got them off nurseslabs.com, right? Free set of questions. You guys can go over there and check those out all you want. They are free, baby, which is why I'm out here doing them. 7-day NCLEX course. My course I created. It is $48 and you get it for a lifetime. There are over 50 videos in there to include a review, y'all. I'm just saying, if you're a nursing student and you just started school, what better flex can you tell somebody that I got an NCLEX review for $48? Just saying. You want to reverse it? Hey, once we go past this, there's no reversing it. Okay? All right, y'all. Here we go. Okay. All right, Tiff, I see you out there. Oh, no, it doesn't even, you guys, it's just an open heart. Okay, man, y'all really going at it. All right, here we go. Here's our answer, y'all, in 3, 2. And the answer is A, protamine sulfate. Right? Protamine sulfate is used to prevent continuous bleeding in a client who has undergone open heart surgery. Protamine is a medication used to reverse and neutralize the anticoagulant effects of heparin. Protamine is the specific antagonist that neutralizes heparin-induced anticoagulation. Protamine is a strongly alkaline polysensation low molecular weight protein found in salmon sperm. Oh, okay. That is also currently available in the recumbent form, which is physiological adaptation. Look, I didn't know that last part. Didn't know that salmon semen can help stop you from bleeding. Yeah. So shout out to salmon. That's what it does. Hey, so here's another good way to remember that, right? So think of heparin, protamine, coumadin, K, right? Heparin, right? Heparin with the P, protamine is the antidote for heparin, right? Coumadin or warfarin is K, so vitamin K, all right? Think about it like that. What's up? My man Jay is here. What's up? Here we go. Oh, salmon sperm. That's what Tiffany, salmon sperm, also has those I got to go back and see it. Salmon sperm that also is available or it's found in, heparin. What's up, brother? Hey, man, I'm good. You know what I'm out here doing? Out here trying to change lives. That is crazy. So shout out to everybody that eats salmon. Question 15. In reducing the risk of endocarditis, good dental care is an important measure. To promote good dental care in clients with endocarditis, and a teaching plan should include proper use of what? Dental floss, electrical toothbrush, manual toothbrush, or irrigation device. I wonder how many people had to bleed out before they find out. Hey, people die in order to find out, medical marvels. Like, look at World War II. We learned a lot. During World War II, even though the way that we had to find that out is just, cost the lives of, millions of people. So that's just how that's how medicine has evolved so fast. So shout out to all 200 plus of y'all. We're doing NCLEX questions. Got them off nurseslabs.com. Free set of questions. I need 10,000 likes. Y'all are over here being greedy. I need y'all to get carpal tunnel right now in the fingers. Make it happen. Love you. Would the review bundle be? Yes, it would. It's actually for both RN and LPN. The biggest thing about the RN and the LPN is that you need to know what you can do, what you can and can't do, what you can and can't accept, and your roles and responsibilities. So Amir says, you're hilarious. I love it. Hey, girl, I appreciate you. I love you too. I love everybody else up in here that's in here listening to me run my mouth. Here we go. And the answer is C, a manual toothbrush. The use of an electric toothbrush, irrigation device, or dental floss may cause bleeding of gums, allowing bacteria to enter and increase risk of endocarditis. Maintaining good oral hygiene and infection control can decrease the incidence of endocarditis in the moderate risk group of patients and can eliminate the necessity of antibiotic prophylaxis of endocarditis, which is part of health promotions and maintenance. What? I know, it's wild out here. That's why it's important that we read rationales. That's why it's important that we read them. The reason why they say electric toothbrushes is because electric toothbrushes, even though they're good for your teeth, can be very aggressive for people that have endocarditis. Okay, you're doing us a favor. Thank you, sir. You're welcome. Is it Isaiah? I think it's Isaiah. And I say it right? Let me know if I said it right. Real quick, shout out to all 200 plus of y'all. We're doing a commercial break. That's what we do. 90s commercials, because I don't really like these other commercials, right? But anyways, we're doing NCLEX questions. Participate. I'm kind of funny sometimes, you know what I'm saying? So make sure you guys participate, share, follow, give me all them likes. Don't be selfish your whole life. Now I'm at 10,000. Hey, now we need 20,000 likes, baby. That's what we need. Don't be selfish your whole life. Hey, if you troll my chat, I'm going to give you a 600. And that means I'm going to ban you. That says, I'm going to ban that ass. So don't be rude, okay? Even though I really truly enjoy banning anyone that comes into my chat acting the fuck up. All right. Nurseslabs.com is where I got these questions. Make sure you guys go over those and check those out for yourself. 7-day NCLEX course, $48. You get it for a lifetime. Yes, it is for RNs and LPNs. That price is going up on the 24th. I'm letting you know that right now. All right. So those links for my coaching and also for the course are in my bio. And we're going to do an Ask Me Anything after this. All right. Somebody said something. It says heals of wrist. 90 days commercials were something else. They really were. They really were. CST. What'd I say? What about CST? Are we talking about surge text or are we talking about Central Standard Time? Which one? Here we go. Question 16. After a long leg cast is removed, the male client should what? Cleanse the leg by scrubbing with a brisk motion. Put leg through full range of motion twice daily. Report any discomfort or stiffness to the physician or elevate the leg when sitting for long periods of time. Oh, surge tech. I got you. I actually used to teach a CST prep course. So all of my students that would go through it, me and a bunch of other instructors would teach them. So we put them through a week-long CST prep, and we had like a 96 or a 94% pass rate. So it was pretty good. Which hence, I did that, years ago, which rolls right into my review now and rolls right into what I'm doing right here. So shout out to all 200 plus y'all. If y'all are new here, we're doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys go over there and check that out. Hey, we're trying to get to 20,000 likes. I need people to get carpal tunnel. I need people to be a statistic, meaning one of these questions. All right, here we go. Here's our answer in 3, 2, and the answer is D. Elevate the leg when sitting for long periods of time. Elevation will help control the edema that usually occurs. Hey, so I'm gonna let y'all know sometimes right now is that a lot of times, sometimes these rationales are not all that good. Like they'll just be one words. But if you go to get other reviews, like if you get UWorld or if you get Archer or if you get Kaplan or some other ones like that, they go into their stuff pretty thorough. Okay. So that is part of basic care and comfort, 6 to 12% on the NCLEX, okay? Remember, it is important that you read your rationales. That is how you retain all of the information that you're learning, okay? That is how you retain it, all right? Nope, there's no also. Here we go. Question 17. When performing a physical assessment on a male client with gout of the great toe, Nurse Vivian, also a stripper name, should assess for... additional, is it tophi or urate deposits on the what? Buttocks, ears, face, and abdomen. If I have anybody named Vivian in here, I'm just kidding. I don't mean it. And I don't mean Vivian, the travel nurse app. All right, I'm gonna give y'all 20 seconds. Oh, hey, also, when I do my Ask Me Anything, I'm gonna show you guys what my course looks like. I'm gonna show you the inside. I'll show you the videos. I'll show you exactly what you get. Hey, remember, you get it for a lifetime, by the way. You're Vivian. You lying. Scorpio, stop lying. You want to get banned. You want to get banned for lying to me right now, don't you? Mm-hmm. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. All right, those are free set of questions. If you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey, okay? You're RN here seeing how you fare. Hey, that's all good. Hey, you got to think, you work as a nurse. There's a lot of those things that you forget in school, and that's okay because, we out here working. That's how we do. But the answer is B. It's ears. Uric acid has a low, a solubility It tends to precipitate and form deposits at various sites where blood flow is least active, including cartilaginous, oh my God, tissues such as the ears, tophi, such as subcutaneous depositions of urate that form nodules, can also be found in patients with persistent hyperuricemia. There you go. And it occurs in joints, ears, fingertips, tendons, and is it bursae? Bursae. Sure, whatever. Tennessee, 2 semesters left. Is it Trisha? Shout out to you, Trisha. All right, y'all. Hey, risk of reduction or reduction of risk potential. All right. 9 to 12% on the NCLEX. Okay. Oh, look, now we have a non, I guess stripper name or whatever, right? So we got 32 days left. All right, Claire and Hannah says 1 semester left. Hey, y'all got it. Y'all are right around the corner. Here we go. Question 18. Nurse Katrina would recognize that the demonstration of crutch walking with a tripod gait was understood when the client places weight on the palms of the hands and axillary region, palms of the hands, axillary region, or is it feet, which are set apart? What are we thinking? It says CNA of many, many years, just accepted to an RN program. Follow 24, just stopping by for the info. I appreciate you being here. Hey, if you want to get this info every Monday, Wednesday, and Friday at 5:30 Central Standard Time, aka Texas time, because that's the only time that matters, make sure you follow. I say that so passively. So yeah, I do this 3 times a week. All right. So it's like the armpit. You are correct. Yes. What? The weight goes on the hand? Come on, Tiff. Come on. Veronica, thank you for the follow. I'll give you guys 10 seconds. The placement. Is it Lissa or Liza? Lissa. Appreciate the follow. Thank you. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. You're confused about the placement. Well, let us find out. And the answer is B, palms of the hand. The palms should bear the client's weight to avoid damage to the nerves in the axilla, right? This is the most used technique. The left and right crutch along with the injured leg are both advanced, while the uninjured leg supports the body weight. Next, the uninjured leg is advanced. Hand grips are part of each class of crutches. They serve as a significant connection between the crutch and the user. Hand grips have always been adjusted or adjustable in the up and down, forward and backward position, depending on the crutch. Part of safety and infection control. Hey, anybody ever used crutches and just leaned on them while they were standing there and you realize how your armpits start to hurt? Yeah, that they're not meant to sit. They're meant to be there as an assistance, not for you to support all your weight on them, because you really can cause all types of damage to the nerves in your armpits. Okay. Carolina says, my hands hurt a lot when I broke my foot. Look, hey, I just had surgery. I had a meniscus repair and I know better. And I did it anyway and it still hurt. And I'm like, ow. Right. So just know all the weight goes onto your hands. Right. Is it Mang Jose with rheumatoid arthritis states, I own the only time I am without pain is when I lie in bed perfectly still. During the convalescent stage, the nurse in charge with Mang Jose should encourage what? Active joint flexion and extension. Was a continued immobility until pain subsides. Range of motion exercises twice a day or flexion exercises 3 times a day. I take my NCLEX June of 24. Oh, you got some time. Abby, we got some time. You're going to be well prepared. When NCLEX comes around. Hey, so shout out to all 200 of y'all in here rocking with me. We're doing NCLEX questions. Appreciate you guys being here. I got them off of nurseslabs.com. They're a free set of questions. So go over there and check those out for yourself. Also, make sure you guys make sure you guys share, make sure you guys follow. That is the trifecta that I need, as well as TikTok needs to get it out to people that need this. So don't be selfish your whole life, okay? Is it Rebel? Thank you for the follow. Alyssa, thank you for the follow. Is it Choir Boy? Not Choir Boy. We brought 5 heartbeats up in here. Appreciate the roses, and I appreciate the roses. Thanks. All right, y'all. Hey, Jaden, appreciate the follow. Thank you. Here we go, y'all. Here we go. Here's our answer. In 3, 2, and the answer is A, active joint flexion and extension. Active exercises alternating extension, flexion, abduction, and adduction. Mobilize. Oh my God. Is it exudates? Oh my God. I forgot how to say that word. In the joints. Relieve stiffness and pain. The role of exercise is promoting the joint health of a person with RA is of great importance, especially as this is the most pronounced and invariant element of RA disease pathology. I'm not gonna lie to you. It's like a robot is kind of reading this or wrote this out. Definitely not Chat GPT, let me tell you. Physiological adaptation. All right, because he's in bed and like bedridden. There you go. Exactly. So physiological adaptation, third largest section on the NCLEX, anywhere from 11 to 14%. Okay, so think about trauma, think about acute care, think about chronic care, all that good stuff. Kevin, who said that? Brooklyn BSN. What said? Pass my NCLEX. Use your advice. Thanks. You're welcome. You're welcome. Hey, everybody right now, give Brooklyn BSN. I need for you, while y'all are answering, I need y'all to give Brooklyn BSN all the love, all the support. Tell them congratulations. Welcome to the greatest shit show on earth. Welcome to nursing. And my two questions to you are, what type of nurse are you, RN or LVN or LPN? Also, what's one tip you can give to the group? Archie, thank you for the follow. Thank you for the follow. Here we go. Question number 20. A male client has undergone surgical surgery. The nurse should what? Observe the client's bowel movement and voiding patterns. Log roll the patient or log roll the client to prone position. Assess the client's feet for sensation and circulation, or encourage the client to drink plenty of fluids. Got to assess. Hey, so yeah, go ahead and give us. It says, as you should, Queen. Wait, what are we talking about? What I do? What happened? Let me see. Got BSN. I don't know what happened. All right, cool. We're about to find out. RN, stay consistent. Okay. Stay consistent. Hey, consistency is the key, right? If you're going to start studying, you need to study, get into a routine, recreate the testing center, have your content, have your Q&A, read your rationales. There you go. You said LPNC. Shout out to you. Also, shout out to all 240 of y'all. We're doing NCLEX questions. Got them off nurseslabs.com. I had Brooklyn BSN just came in here and told us that they passed their NCLEX, so shout out to them. Hey, I give everybody their love and their flowers when you come in here and you tell me that you're successful. Also, if you come in here and tell me that you fail, I'm going to tell you I don't care. But then I'm going to show you some love and tough love and tell you that, hey, we're going to figure that out. And I say we, because that's how we do around here, all right? We uplift each other. We don't break each other down, because if you want to break somebody down, let me know so I can fucking ban you. Anyway, so the answer is C. Assess the client's feet for sensation and circulation. Alteration in sensation and circulation indicates damage to the spinal cord. If these occur, notify the physician immediately. Assess movement and sensation of lower extremities and feet and hands or arms. Although some degree of sensory impairment is usually present, deterioration and changes may reflect development or resolution of spinal cord edema and inflammation of the tissue secondary to damage to motor nerve roots from surgical manipulation. That is reduction of risk potential. I'm a repeat test taker. I came in your live. You gave me some advice. Thank you. Never gave up. That's what I love to hear. Hey, for y'all that don't know, if you fail your NCLEX, just know I understand. Just know I understand, because I failed mine 3 times. And let me tell you something right now, no job and no one is going to care. Shout out to Madison, Wisconsin. All right. No job. No one is going to care that you failed your NCLEX. They just want to know, do you got a license, so they can put that ass to work? And I'm just letting y'all know that. Keeping it all the way real. Here we go. Break time. Commercial break. 90s commercial break. All right, we're doing NCLEX questions. Make sure you guys participate. I'm kind of funny sometimes, but whatever. Make sure you guys share. Make sure you guys follow and give me all them likes. Hey, we need 20,000 likes, y'all. 20,000 likes. Y'all got to make it happen. Hey, don't come into my chat. Don't troll me. If you troll me or anybody else, I'm going to ban that ass. I promise you, okay? I really enjoy banning people. I talk about it for days. Nurseslabs.com is where I got these questions. They are free. You are welcome. Also, 7-day NCLEX course, which is my NCLEX course. It is $48. We have over 50 videos in there to include a new generation NCLEX review that I've just put the last 2 videos up there last night. That price of $48 is going away that time and that date. I promise you. You try to look for it on the 4th or the 4th. If you try to look for it on that Friday, it won't be there. Also, if you need tutoring or want tutoring for NCLEX, I got you. You can check those links out in my bio. And I'm going to do an Ask Me Anything after this. So whatever question you guys got in regards to nursing, or if you want to be personal or whatever, I got you. Question 21. Marina with acute renal failure moves into the diuretic phase after 1 week of therapy. During this phase, the client must be assessed for signs of developing what? Hypovolemia, renal failure, metabolic acidosis, or hyperkalemia. What are we looking at? What are we looking at? Is it Sukmandeep? Sukmandeep, appreciate the share. Thank you. Hey, I pride myself on trying to pronounce people's names correctly because, we're all unique out here. I think I met a girl named Unique. Pretty sure she was a stripper. Anyways, what y'all got for me? What y'all got? We got A's, we got D's. Lex, thank you for the share. Is it Trey or Try? Thank you for the follow. Tiffany says C. All right. You guys hear my... Oh, man. He crying about something, y'all. I don't know. All right, y'all. Here we go. All right. Here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is A, hypovolemia. In the diuretic phase, fluid retained during the oliguric phase is excreted and may reach 3 to 5 liters daily. Hypovolemia may occur and the fluid should be replaced. The diuretic stage usually lasts for 1 to 2 weeks but can persist longer. In this stage, an increase of urine output is noted and uremia begins to resolve as the kidneys continue to heal. That is part of physiological adaptation. All right, third largest section on NCLEX at 11 to 17%. Shaking my head. I need to stop second guessing myself. Hey, Tiffany, I'm telling you, hey, RTFQ, your first answer or your first intuition answer, that is usually 9 times out of 10, that is the correct answer. Okay. Loss of vascular fluids. Yes, sir. Yes, sir. All right. Hey, I'm trying to tell you, select all that apply. Usually people get that wrong because they select one more than they should have selected. They don't read the question and they change their answer. Those 3 things you have got to change within yourself. Okay. Here we go. Question 22. Nurse Judith obtains a specimen of clear nasal drainage from a client with a head injury. Which of the following tests differentiates mucus from cerebral spinal fluid? Is it protein, specific gravity, glucose, or microorganisms? Right? I probably shouldn't have said it like that, but y'all know what's up. Oh, never mind. All right. Ernisha, you know better. You know better, ma'am. You've been here long enough to know we don't play those games. Tiffany says sugar. Where do you see sugar at? Oh, you mean glucose? Oh, okay. All right. We good around here. All right. Tasha says glucose. All right, Tasha. All right. See, the brain loves sugar. Yeah, it does. Delicious. Hey, if you guys are new here, we're doing NCLEX questions. Hey, we need 20,000 likes. Y'all stopped just shy of 20,000 likes. What's up with that? All right. Hey, got these questions off nurseslabs.com. All right. They're a free batch of questions for you guys. You guys can go over there and check those out for yourself. Also, if you are new here, I want to know who you are, where you're from, and where you are at in your nursing journey. You got me, Tad and Mama? I got you. I appreciate you out there. All right. Let's see what the answer is, y'all. Let's see what the answer is. And 3, 2, Samantha Ibarra, you're new here. Well, I'm glad that you're new here. All right, here we go. And the answer is sugar or glucose, right? The constituents of CSF are similar to those in blood plasma. An examination of glucose content is done to determine whether a body fluid is a mucus or a CSF. A CSF normally contains glucose. A true normal range cannot be given for CSF. CSF glucose. As a general rule, CSF glucose is about 2/3 of the serum glucose measured during the preceding 2 to 4 hours in a normal adult. This ratio decreases with increasing serum glucose levels. CSF glucose levels generally do not go above 300 milligrams per deciliter, regardless of serum levels. That is a reduction of risk potential. Appreciate all the follows. Appreciate y'all giving me the 21,000 likes. I love it. Y'all are Gucci out here. I'm from the Philippines, working in KSA, currently in the UK, and will soon take NCLEX. Shout out, is it Jacob? Shout out to you, Jacob. Shout out to you. I think I met one person that was in the UK that was going to school to be an RN. So I know y'all stuff is very, very different over there. So you're going to do great when you finally take that exam. Okay, here we go. Question 23. A 22-year-old client suffered from his first tonic-clonic seizure. Upon awakening, the client asked the nurse, "What caused me to have a seizure?" Which of the following would the nurse include in the primary cause of the tonic-clonic seizure in adults more than 20 years? Is it electrolyte imbalance, head trauma, epilepsy, or a congenital defect? I actually had a patient go into a tonic-clonic seizure when we did a spinal on her, but She had been having neurological issues and did not disclose her medical history. So she had a seizure while she was on the operating table, y'all. I mean, clenching jaw and everything. And the way that she explained it, she could hear my voice, but it was like she was crawling through a cave. And I was like, yo, that shit is wild. That is wild. That's why when you guys go to your doctor and you have surgery or anything, disclose your medication. Medical or medication reconciliation, y'all. That's why that is important. That's why that is there. Studied in the Philippines and currently trying to prep for NCLEX in the U.S. I got you. I'm tracking. Hey, I just want to let y'all know I do coaching one-on-one. So if anybody's interested in coaching, you can check that link out in my bio. Graduated 2 years ago. Life happened. Need to retake the NCLEX, so I'm here. Samantha, that's what I love to hear. What is a good hemoglobin level? That's a good question. Who can answer that question? Epilepsy is seizure, correct? All right, so the answer is head trauma. Trauma is one of the primary causes of brain damage and seizure activity in adults. Other common causes of seizure activity in adults include neoplasm, withdrawal from drugs and alcohol, and vascular disease. Common causes of emergency department visits after seizures are alcohol and drugs, head injuries, and epilepsy. That is part of physiological adaptation, the third largest section on NCLEX at 11 to 17%. So most hemoglobin you'll hear it's 12 to 16, 13 to 16. In pregnant women, it'll be a little bit lower at like 10. So it all just depends. A lot of literature, they're off by like maybe onesies and twosies, but on NCLEX, they'll drop, hey, you have a hemoglobin of 6. Everywhere will tell you that a hemoglobin of 6 is bad, right? So those are the things you got to know what the normal ranges are, but you need to know what to do or what it's going to look like when a patient has a hemoglobin that's too high or if it's too low, all right? So 12 to 16 or 12 to 18, whatever, depends on male or female, but usually on the broad spectrum, you'll see 12 to 18, right? Because one's 14 to 16, one's 12 to 18 or 12 to 16. Like I said, if it's way out of range, then it'll be a totally different story. Here we go. Question 24. What is the primary nursing assessment in the first 24 hours after admission of the client with a thrombotic CVA? I was about to say a thrombolytic, but a thrombotic CVA. Is it pupil size and pupillary response? Is it the cholesterol levels? Is it the echocardiogram or bowel sounds? What we looking for? Shout out to all 180 something of y'all. We're out here doing NCLEX questions. Hey, we had 20. Hey, let's get to 25,000 likes. Let's get there. Smash. Hey, get carpal tunnel right now. Hey, if you're new here, welcome. We're doing NCLEX questions. I got them off nurseslabs.com. Free sets of questions. You guys can go over there and look those up for yourself. All right. Also, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. From Australia, preparing for the NCLEX exam. And hey, shout out to Australia. What part of Australia do you live in? I have some friends that live in is it Brisbane? I don't know my geography in regards to like where exactly it is. Hi, I'm from Trinidad. Okay, in Wisconsin. My second year in nursing school. Happy to come. I'm glad you're here. Glad. Super happy that you're here. Board exam question. Are you asking me? What are you asking me, Camille? Low blood pressure. Okay. All right. Here we go. And our answer is, of course, A, pupil size and pupillary response. It is crucial to monitor the pupil size and pupillary response to indicate changes from the cranial nerves. Pupil reaction as regulated by the ocular motor or the third cranial nerve and are useful in determining whether the brainstem is pupil size and equality is determined by balance between the parasympathetic and sympathetic innervation. Response to light reflects the combination function of the optic and the ocular cranial nerves, right? So we're going to think of PERLA, right? So pupils equal, round, and reactive to light and accommodation when we have somebody that has any type of cerebral vascular injury, right? And then also you got to think about it is like, what are the pupils going to look like? Are they going to be constricted? Are they going to be dilated? What if they're uneven? Like, what if you have a blown pupil? Like, what if you have one that's constricted and one that's massively dilated? Like, what are we looking at? And then you got to think about, what can I do to take care of this patient after that point? Okay, that's where the clinical thinking or the critical thinking and the clinical judgment comes into play. LPN and finally going to my bridge program after 26 years. Shout out to you. Never too late. I take my NCLEX tomorrow. This is a good practice. Shelby, I need for you to get off my live because you don't need to be practicing or looking at nothing. You should be relaxing right now. You should not be looking at anything NCLEX related. So, ma'am, I respectfully vacate the premises before I call the cops, okay? So I'm just saying, if you don't know it by now, you don't know it at all. You're good to go. Come back on Friday and let us know, All right, here we go. Question 25. Nurse Linda is preparing a client for multiple sclerosis for discharge from the hospital to home. Which of the following instructions is most important, right? Practice using the mechanical aids that you will need when future disabilities arise. Wow. Follow good health habits to change the course of the disease. Keep active, use stress-reducing strategies, and avoid fatigue. Or you will need to accept the necessity for a quiet and inactive lifestyle. What are we looking at? Hey, by the way, if you guys are new here and you come in here and you tell me that you're taking your NCLEX tomorrow, I will tell everyone that you don't need to be looking at anything NCLEX related. Doing this is equivalent to trying to cram the day before an exam. You need to go and try to get your mind right and be prepared for what you're about to partake in, okay? I'm just giving you advice from somebody who's failed their NCLEX 3 times and passed it on the 4th, right? None of y'all would have ever known that. If you were new here, you would have never known that until I told you. And no part of me cares if anybody likes that or dislikes that. But shout out to everybody that's in here. I have to repeat my HESI tomorrow. That's all good. That's okay. Hey, if you repeating a test is the worst thing that you could do today or the next day, I think I'm okay with that. You failed times 2. Sam. Can I call you Sam? I'm going to call you Sam. Or do people call you like Sama Bama? But that's okay. That's okay if you failed, y'all. It's okay. Here we go. Answer is C. Keep active. Use stress reduction strategies and avoid fatigue. The nurse's most positive approach is to encourage the client with multiple sclerosis to stay active, use stress reduction techniques, and avoid fatigue because it is important to support the immune system while remaining active. Recommend participation in groups involved in fitness or exercise and or the Multiple Sclerosis Society. Can help the patient to stay motivated to remain active within the limits of the disability or condition. Group activities need to be selected carefully to meet the patient's needs and prevent discouragement or anxiety. That is part of health promotions and maintenance. What did you do different that you think you can help with? Well, I talk about that all the time. I found out I failed my OB class by a halfway point. Hillary, that's okay though. I feel like I've tried almost everything. Is it chastity? I can guarantee you have not. But we'll talk about that in the AMA. Just remind me, okay? Here we go. Commercial break. Commercial. Make sure y'all smash that like button. I want 25,000 likes. Make it happen. Let's do it now. We're doing NCLEX questions. Got them off nurseslabs.com. They are free questions, y'all. They are free questions. Go over there and check them out for yourself. Participation is the key. I'm kind of funny sometimes, but that's your prerogative if you think that. Make sure you guys like, make sure you guys share, make sure you guys follow. That's the trifecta that TikTok needs, and I need that. So don't be selfish your whole life. I'm giving y'all this, so y'all give me that. All right? Hey, if you act a fool on my chat, I'm going to ban you. I'm going to give you a 600, which means I'm going to ban you for 10 minutes. AKA, I'm just going to ban you forever because I'm not going to go back and look you up. And I will ban you. And I enjoy it because I'm petty. So nurseslabs.com is where the free questions are. Also, if you're looking for the NCLEX review, it is thebootnurse.com/special. Also, that link is in my bio. You can check that out as well. It's for $48 for a lifetime. It's not a joke, not a game, and the price is going away on this day and at that time. Also, if you're looking for one-on-one coaching, thebootnurse.com/coaching. I do that as well. Strictly for NCLEX, y'all. Strictly for NCLEX. I know I get asked a lot. Also, I'm going to do an Ask Me Anything after this, okay? Here we go. Question 26. The nurse is aware that the early indicator of hypoxia in the unconscious client is what? Cyanosis, increased respiration, hypertension, or restlessness. What are we looking for? Shout out to all 200 of y'all in here. There's a lot of things I had to change, y'all. A lot of things I had to change. First thing is your mindset. Like if you sit there and you allow a test or you allow anybody's verbiage to distract you from your goal, then you've already lost. So your first thing you need to do is change mindset, especially if you failed more than once. All right. I'm a military guy, y'all. I've been in the Navy for 16 years. I'm a very regimented person. So when I hone in on something, I am like obsessed with it. So when it came for me studying for my NCLEX and finally getting it, there was nothing that could stop me. Nothing, no one, nothing you could say. You'll find out who your real friends are when you guys are studying for this exam and when you're in nursing school. Cyanosis is a late sign. Yes, sir. Indeed it is. Got them blue lips. All right, y'all, here we go. Shout out to all 300 plus of y'all. If you guys are new here, welcome. We're doing NCLEX questions. Make sure you guys smash the like button. You guys share and follow. And the answer is restlessness. Restlessness is an early indicator of hypoxia. The nurse should suspect hypoxia in an unconscious client who suddenly becomes restless. When oxygen delivery is severely compromised, organ function will start to deteriorate. Neurologic manifestations include what is it? Restlessness, headache, and confusion with moderate hypoxia. In severe cases, altered mentation and coma can occur, and if it's not corrected quickly, can lead to death. That is part of physiological. Yes, Sophia said. Sophia, can I call you Sophie? Anyways, physiological adaptation, third largest section on the NCLEX at 11 to 17%. Okay, hey. Management of care, pharmacology, and physiological adaptation make up 44 to 49% of the entire NCLEX exam. All right. So just be aware of that. Oh, I can call you Sophie? Gucci out here. I appreciate it. But if they're conscious, that means they're conscious. They don't say, all right, I'm gonna go back. I don't ever go back. But where over here do you see if? The moment that you see that it says if, or if anything like that, you're gonna get the question wrong. All right. So don't say, what if it's if? Well, we'll find out when we get there. And if you have a patient who is conscious and they are restless, you better start assessing your patient. Don't add anything. If you add stuff into that question, you will get it wrong. And then you're going to wonder why you didn't do well on that. And that's not even on the NCLEX. That's on any question. All right. Question 27. The client is experiencing spinal shock. Nurse, is it Myrna? Nurse Myrna? I don't know why they got to put nurses' names in here, but whatever. Should expect the function of the bladder to be which of the following? Normal, atonic, spastic, or uncontrolled. It says, I graduated in 6 months, currently in peds. Critical care is next, and I'm so nervous. Cass. Critical care is Gucci. They're unconscious. Correct. They are unconscious. They didn't say anything. Hey, they didn't say anything about what if they're conscious? Go ahead and answer the question if they're conscious. And if they are conscious and they're restless, you might want to start thinking about, remember, because if they're restless and they're having hypoxia, what's the first thing I want to do if I see somebody who's restless and they're possibly hypoxic? Give them oxygen, right? Or now we're back to our ABCs. Hey, restlessness is a part of your part of your level of consciousness, right? It's part of your altered mental status, right? LOC, ABCs. Don't forget that. All right, y'all. 10 seconds. Is it Anika or Annika? No, Annika. Hey, so my 2 favorite words, Annika and Monica. I'm just playing. Hey, make sure y'all smash that like button and get me to 30,000 likes. Stop playing games. All right, y'all, here we go. Here's our answer in 3, 2, and the answer is B, atonic, right? In spinal shock, the bladder becomes completely atonic and will continue to be unless the client is catheterized, right? So we go back to our medical terminology. If there's an A in front of anything, that means what? Hey, there's so much hope there, but you missed. You see what I did there with your name? Hope. All right, I'm just playing. I'll excuse myself. Love you, Hope. The full spinal examination should include motor sensory reflexes, including, is it the bulbo cavernous reflex and the anal wink reflex, right? Is it the motor activity and strength decreases not only in the skeletal muscles, but the motor activity of internal organs like bowel and bladder. This decrease leads to constipation and urinary retention, part of physiological adaptation. Remember, the third largest section. Yeah, A means absent, right? Without, right? So that means the bladder's not working. That means you got to give them a catheter because they're not going to be able to pee. They're not going to be able to do anything. Get rid of any of that urine, okay? All right, y'all. Good job. Shout out to y'all. Question number 28. Which of the following stages is the carcinogen irreversible? Is it the progression, the initiation, regression, or promotion? What are we thinking? What are we thinking? Shout out to all 250 y'all. Listen to me run my mouth. If you're new here, make sure y'all smash that like button. Give me 30,000 likes. Give me 30,000 likes. Got these questions off nurseslabs.com. Guys, go over there and check those out for yourself. Also, if you are new here, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, if you're not a nurse, then what you doing in here? Trying to get my learn on, Kevin. Sorry if you guys hear my co-host in there. He's over there acting up. Not Shondell looking like Nurse Alice. All right, y'all, I'm gonna give y'all 10 seconds. Indiana, second year BSN. Okay. Bad and bougie. Bad and bougie. Cooking Lindo with Lil Uzi. Third year nursing student for BSN. Shout out to you, Caitlin. Shout out to you. Just guessing here. I would rather you guess. You have a 25% chance of getting it right versus a 0% chance if you don't guess at all. trying to get my learn on, Kevin. Hey, Mama Cat, I appreciate it. Hey, get your learn on. We learning 3 times a week out here. Hey, it might go to 5 times a week. It might. And the answer is A, progression stage. Progression stage is the change of tumor from the pre-neoplastic stage to a low degree of malignancy to a fast-growing tumor that cannot be reversed. Tumor progression comprises the expression of the malignant, is it the phenotype, and the tendency of malignant cells to acquire more aggressive characteristics over time. Also, metastasis, I'm pretty sure I said that wrong and somebody's going to correct me, but also metastasis may involve the ability to, or the ability of tumor cells to secrete, proteases, that allow invasion beyond the immediate primary tumor location. A prominent characteristic of the malignant phenotype is the propensity, oh Lord, for genomic instability and uncontrolled growth. Whatever, bro. What the hell ever. Physiological adaptation. Okay, there we go. Nope, said it right. Spreadness. All right. Yep. Spreading. Shakira from Jamaica. Oh, Shanika. Not me saying Shakira. Oh, I don't mean no disrespect. Look, Shanika from Jamaica. Shout out to you, ma'am. Shout out to you, Missy. I appreciate you. Hey, sitting here and reading these, people don't realize how hard it is. All right. Wanderlust 3 weeks ADN. Shout out to you. I'm over a year into working as RN and I keep logging into reviews live, just keeping it. Oh, okay. Shout out to you, CJ. Shout out to you. Here we go. Question 29. Among the following components, thorough painful assessment, which is the most significant causing factor or intensity. LPN for 20 years. Shout out to you, ma'am. Been a nurse for 20 years. 12 years, bro. I do not know how to read. I'm getting Wanderlust. I'm getting my life together. I promise. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Make sure you guys like, share, and follow. Go ahead. 5 years. MP up next. That's what I'm talking about. Hey, I've been a nurse for 3.5 years. I've worked in the burn ICU, medical ICU, and a neuro ICU. Also, I've worked in the PACU, or the recovery room, or post anesthesia care unit. And I also now work in the operating room as a OR nurse. The inability to get these right is painful. That's okay. That's why it's practice. Pain ain't never killed nobody, but a priority cancer. Hey, that sounds familiar. Hey, I'm also making like PDFs, y'all. I'm making PDFs that I can start to give away. I have one right now that I'm going to give away talking about test strategies. It's pretty dense. I think you guys are going to like it, and I'll start posting that so people can start grabbing that as well. All right, y'all, here's our answer. In 3, 2, and the answer is D, intensity. Intensity is the major indicative of severity of pain. And is important for the evaluation of the treatment. Severity of pain may include the intensity graded by the patient or the impact pain has on function. Intensity may be assessed with certain scales that will be reviewed below. The impact of function may include changes with activity of daily living, activity level, and work-related duties. Pain may have an impact on sleep, mood, appetite, or social relationships. That is physiological adaptation, which is the third largest section, of course, on the NCLEX at 11 to 17%. All right, you guys be aware of that. Hey, remember that physiological adaptation, pharmacology, and management of care are the 3 largest sections on the NCLEX, combined 44 to 49%. All right, almost half of that exam, you're going to be looking at getting stuff like that. Okay, so here we go. Shout out to y'all. Question number 30. Hey, 30 questions, 30,000 likes, maybe. I don't know. Am I being greedy? Probably, but whatever. A 65-year-old female is experiencing a flare-up of, pruritus? Which of the client's actions could aggravate the cause of flare-up? Is it sleeping in cool and humidified environment? Is it daily baths with fragrant soap? Is it using clothes made from 100% cotton, or increasing fluid intake? Who is that? Lorna. What is N? I'm guessing you mean B. Pretty K says B, easy. Okay. Hey, usually when people come here and they say, hey, that's easy, they get it wrong. Hey, I ain't saying I want you to get it wrong, but you possibly could get it wrong. Is it Rena? Thank you for the follow. B, easy. Okay. Is it Jabria? Did I say that right? Hey, y'all let me know if I say these names right. All right, Lorna says B. I got you. Man by, well, I don't know. You telling me to leave or you telling you to leave? Where do you want me to go? Oh, I got you. I got you, Lorna. You good. Jabria. Okay. I get the claps and everything. I'll be getting names right. You know what I'm saying? Here we go, y'all. Here's our answer. Here is our answer in 3, 2. Is this a true or false, right? What? No, not a true. No. Here we go. And the answer is B, daily baths with fragrant soaps, right? The use of fragrant soap is very drying to the skin, hence causing paresis. Avoid factors that may contribute to skin dryness, such as overheating, hot baths, soaps, shower, and bath products. Use emollients for dry skin, including for washing, bathing, and showering. Right? Physiological adaptation, third largest section. All right. You can use true or false you can use true or false strategies. You can. But that ain't a true or false question. So you can use true or false question, the strategy when it comes to eliminating the question for sure. Most definitely. All right. So Pretty K, thank you for the follow. Appreciate you. Yeah, but definitely for with select all and apply questions, you most definitely. But with these type of questions, no. Hey, but ladies and gentlemen, that is it. If you missed all these questions, I'm sorry. I usually start at 5:30 Central Standard Time, Texas time, because that's the only time that matters. So we are done with the questions for tonight. We're going to do an Ask Me Anything. And I'm also going to show you guys what the course looks like, because I get that question a lot. So I appreciate everybody participating, hanging out with me. Also, I love the fact that you guys come over here, like, and you guys share. Oh, you were kidding. Hey, see, you can't be kidding about stuff like that. It's hard to take context through the messages. But I got what you're saying, Missy. I'm picking up what you're putting down. Hey, I didn't have to ban nobody. I'm a little sad about that because I'm pretty petty. But nurseslabs.com is where I got these questions from. You guys are most definitely can go over there and take those. They're free. I listen to you when I'm at work. Tiffany, I appreciate you. Hey, bro, I passed my NCLEX last week. Shout out to you, Mohammed. Hey, everybody give Mohammed his love right now. Everybody tell Mohammed that you guys are proud of him and let him know what the deal is. Welcome to the greatest shit show on earth. And I said on earth because nursing is universally a shit show. And but, you know, definitely one of those that I'm proud to be a part of. So welcome to being a nurse. If you have any type of advice, give us one thing of advice and let us know what type of nurse that you are. Also, 7-day NCLEX course. We're in our pre-launch phase. It is almost done at $48. It's a lifetime. It's going away at that $48 price, and it's going to something else. All right. It's actually going to go to $97. So I'm just letting y'all know that right now. Also, if you're looking for tutoring 101, that is also in the link in my bio. And now we're going to turn this thing around so you guys can see. No, I'm going to show you guys what the course looks like. So I get asked that question all the time. So here we go. So this is the website real quick. I'm going to back it up so you guys can see it, because I get asked this question a lot. It's a 7-day course pre-recorded. Yes, they're on-demand videos, right? They're on-demand videos. All right, so this is what it looks like, the website, y'all, right? So right here, pre-launch bonus, right? That means you get it for a lifetime. Yes, I said a lifetime. And it is for $48. It's not a joke. It's not a game. Once you click on any of these buttons that look like that, that's exactly where it'll take you. And then this is me, you know, talking about my journey, what it comes with. And also for the question, it is for RNs and LPNs. All right. So go down, a couple of testimonies. This is what you'll learn. This is one of many things that you will learn. The mindset, the structure of the NCLEX, critical thinking. We talk about pharmacology. I have 18 pharmacology videos in there, y'all. 18. All right. Management of care, we talk about that. Physiological adaptation. Notice how I talked about how those are the 3 largest sections on the exam, right? Also, we talk about what to expect the day before, the day of, and after the NCLEX, right? And also, of course, there's that. And here's the curriculum, right? And what I'm working on right now is this, right? I'm breaking down the NCLEX by these topics, right? By management of care, pharmacology, so on and so forth. All right. Those are going in there, but I can tell you what's in there right now. That's in there. And I'm going to show you guys that here in a second. Right. So here's some other stuff. Hey, I failed the NCLEX 3 times, y'all. And I spent this much money, a lot, from the exams to study material, you name it. You also get to be a part of the Facebook. That's me when I was at the Burn Center. That's a legit picture. So, and I talk about a little bit about my story if anybody wants to know about it. And it tells you who this course is for. One thing I don't like is I don't like lazy people, and I don't like people that make excuses. So if you want to come over there and make an excuse on why something doesn't work for you, then hey, and you probably can't be part of the circle. But I want you to be a part of the circle anyway, because we can all do this. Couple of testimonies right down here. I've been doing this. I've been coaching y'all since 2020, right? And then there's all this stuff down here, right? And then also, if you don't like it, you know, after 7 days, you can get a refund, right? But then I'm telling you, it's dense. And I'm going to show you right now, money. All right. No, not that one. There we go. There's that one. So here's this one right here. This is on the inside of the course, right? So right here, here's the first video, right? And then down here, we talk about what's in the NCLEX. We talk about computer adaptive testing, the passing standard, the test plan, which is the updated test plan from April of this year. Talk about answering NCLEX style questions, critical thinking, like you have to critical thinking and clinical judgment along with analysis and applying and application are the type of questions that you want, right? And then right here, we have the new generation NCLEX review, right? Mallory, I'm almost done with my first semester, still holding A's. Any advice for a care plan? Hey, if you want to know about care plans, go to nurseslabs.com. They help you out tons there, right? So right here, I'm going to show y'all right now. Y'all see that? So this is where we're talking about questions. Like, look familiar, right? We go through it with God. Everything is possible. Yep. Right. Can you please explain more on case studies in the NGN? So as a matter of fact, is this number? What number is this? I'll show you right now. So could I go over? We'll go to number 2 and I will play. So with the case studies, I'll show you. Whoops, I went back too far. Let me find it. Right. So with the case studies, like they give you a scenario. They give you a scenario, right? And then they give you everything that you could possibly want. They tell you about the general the general outlook of the patient, you know, your assessment, so on and so forth. You get your vitals, and then they ask you a question. And when they ask you that question, based off of your case study, what answers do you select? And when I go through this review, when I'm going through questions, we figure out the topic first, right? You can have a minimum of 3 case studies. Right. You'll at least get 3. I've heard some people getting 6. I heard of some people getting like 8, 7, you know, so but the minimum you'll get is 3. So it says, is it only 7 days or it expires? No. So it's 7 days because we go over the concepts of the important things within 7 days. Right. But it's an on-demand course and you have it for a lifetime. You asking for a friend? You could ask for you. That's OK. Also, so, yeah, so you'll get, you know, select all that apply. You'll get questions like you'll get questions that look like this. Right. And so you'll have the closed ones like the drop down. Let me see. Zoom in on that. So you'll get the drop down and you have to select. You'll get other ones that look like, let's fast forward. So it looks like that. And then you'll have other ones that are anticipated versus not anticipated. Right. So if you guys go to the link in my bio, once you click on it, it'll say 7-day NCLEX course right now. OK, and it's going for $48. If you guys are new here, I'm showing everybody what my course looks like. Right. This is part 2 and each video is less than 30 minutes long. Have you heard anything about the new legislation? What new legislation? That tells me nothing. Brianna, what legislation are you talking about? Hey, long time. What's up, Sandy? How are you? So we talk about this. Right. We go over new generation NCLEX questions. What's anticipated, indicated. I actually have some bow ties in here. And with the new generation NCLEX review by itself, we go over 100 questions. Right. So and then here you got other ones where you have case studies, so on and so forth. How long is the access? The access is for a lifetime. Like if you go to the website, that's what it says. You have it for a lifetime. It's not a joke. It's not a game. We're in our pre-launch phase. And when in my pre-launch phase, that is my gift to the people that essentially are supporting the growth of this. Yes, this is my program, Sandy, but this supports the growth of the program because, hey, I'm not stopping doing this. I thoroughly enjoy doing this. It says, get it. I'm only my 2nd semester. I didn't want to miss out. Hey, and I'm letting you know because the price is going up on Black Friday. I know people are just like, why would it go up? Well, because it's dense enough for it to warrant a price increase. All right. And so we talk about that. And then also down here, look over here towards the left, y'all. Here's my pharmacology section, right? How to study pharm, dosage calculation, freaking, anti-infectives, antibiotics, antivirals, antifungals, antidiuretics. I think I talked about redondavant in the antidiuretics, right? My cardiovascular meds, IV fluids, diuretics, right? This is 18 videos, right? I might actually just move this out and put it as a separate program because some people just want pharmacology, right? So, and then down here we have, fluid and electrolyte imbalances. Cardiology only has 1, but there's going to be like 9 or 10 more that are going to go in here. Talk about endocrinology. That's all that's in there. There's over 50 videos in here right now and you get it forever, which means you get all the updates. You get all that stuff that comes in the program. OK, so check the link out in my bio. It is labeled the 7-day NCLEX course. You guys can go over there, look at the website, check it out. and it's for $48 until next week, right? And so it says it right there. I have a countdown on there, right? So I'm going to show this one more time for people that want to see it, right? So this is what the website looks like. This is the limited time pre-launch sale right here. Talks about how it's for a limited time. The normal price, when it's all said and done, y'all, it's going to go up to this right here, to $347. All right. But it's going to $97 on Black Friday. I know. So we were like, wow. Right. And it is for RNs and LPNs. Right. And it expires on this day. I have it right there. Okay. And it also says it on the sales page. So you can't say that I didn't see it. What method do you use for math? I use dimensional analysis, but it all just depends on what the question is asking. So, and when it comes to doing dosage calculations, it's all about practice. It's all about practice. Okay. So what's included? Let's see. And when you go to the website, look at the website, right? And it'll tell you this is what it includes right here, right? You get it for a lifetime and you get the mindset. But the biggest thing that's right here is that you get the NCLEX review, right? I'm going to show you right now. So the NCLEX review right here, you get this all on demand. And you get an NGN review all on demand. It says, I don't want to switch from nothing else midway through, but Kevin, that seems amazing. Hey, you do you. I'm just saying that it's there. I'm just saying I'm a huge content guy. And then also you get all this content, right? And you get everything that is added. You get everything that is added. It reminds me of the Kaplan setup. It's kind of like the Kaplan setup because I used Kaplan. I used Archer. No, I'm sorry. I used Kaplan. I used UWorld and I used, Kaplan UWorld. I use Mark Klimick. I used a bunch of other things. They essentially kind of give you like the motivation on how to set things up. So I liked how Kaplan's setup was because I used Kaplan. So if it looks like Kaplan, that's where I got the thought process from. So, but yeah, so that's what it looks like. And then you guys can go down there. You guys can check that out. And then of course, this is what it looks like on the inside. And right now I have, I'm getting about 8 to 10 videos edited right now on top of, I'm working on some PDFs that I am going to be giving to people that are only inside the program. Like there's going to be an email that's going to come out about that. All right. So, and I'm working on trying to get those out there. All right. But I'm going to go ahead and I'm going to turn this thing around so everybody can see my face. What's up, y'all? How y'all doing? I know I got like a rogue hair going on over here. UWorld and Mark Klimick. I used UWorld and Mark Klimick at first when I studied. I personally am not a big fan of UWorld like that. But, you know, to each their own. There's so many different things that you guys can do out there. But what's up? What's up? Is it Chastity? What's up? You booked and busy. What you mean? Am I booked and busy? Right now, I have 9 people that I'm coaching actively right now. I usually coach about 10 people a month. And so, yeah, it definitely keeps me busy. But, you know, the best thing about it is for me is watching people grow and watching people get that license. Because remember, I failed my exam 3 times, y'all, and I passed it on the 4th. Nobody would have ever known that unless I openly said, hey, I failed my NCLEX, right? I'm not a fan of Kaplan. Some people aren't. That's what I'm saying. There's tons of other things that are out there for people. I'm a huge content guy. Huge content guy. So the majority of my stuff you're going to see is going to be on content. And I'm working on getting my own batch of NCLEX style questions. That's going to come, later on down the line. Okay. But it's coming. It's definitely coming. But hey, welcome. Y'all got me to 30,000 likes. I appreciate y'all. Y'all can keep smashing that like button. But I want to know who you are, where you're from, where you're at in your nursing journey. What questions do you guys have? And, who said that? Who said I just passed? Just passed my NCLEX RN. Hey, shout out to you, Tori. Congratulations. Welcome to the greatest shit show on earth, known as being a nurse, whether it be a RN, LVN, or LPN. Congratulations, everybody, right now. Give Tori her love. Right now. Give Tori your love. Tell her congratulations. Tell her that you're proud of her. Tell her welcome to the shit show. All that good stuff. Will being in the military help me get into to med school? Going into the military can help. Hey, stop spamming. Stop spamming that question or I'm about to ban that ass. All right? So going into the military, it can help you. However, it can help you, but it can't. If you don't put in the work to do all the prerequisites that you need, then you being in the military won't matter, right? Because I've seen plenty of people who are active duty in the military apply for med school and not get it. That's the question that you asked me. Did you ever reschedule your exam? I never rescheduled my exam. I always set my exam out at least 45 to 60 days out, just so I know it held me accountable because I knew I had a deadline. When you set up a deadline for yourself, then that makes it that much more real and that much more important. Can you clarify about your 7-day NCLEX program, end of November 23rd? Are you creating a new one? No, Vaughn. So that price is going away. So it's priced right now at $48 for a lifetime. But then after that, it's going to $97. And it's still going to be that's the Black Friday deal, right? It's going to go to $97, right? And then it's going to stay that way for Black Friday. And then it's going to go up to the full price of $347. So if you want to get it right now and you get it for a lifetime and you get all the updates that come with it, you get it. And I'm always on here. I answer questions all the time. I'm pretty active. So, I drop stuff in there all the time. I'm actually about to send out an email either today or tomorrow to let everybody know that the new generation NCLEX review is all the way up in the next. And I like to try to do things in stages because I'm only one person, got a family, got a job, got all that stuff. Oh, you get it yes, Jackie, you get it for a lifetime. It says it on the website, madam. It says it on the website. Nikki says, I graduate spring of 24. When should I start studying for NCLEX? So if you graduate spring of 24, which means May, I would start studying for NCLEX April. Because if you got April, you got May. By the time you get your authorization to test back, you should be testing in June. From that time, you should be able to get that done. That's my recommendation. Tina 27 still doing prereq. Shout out to you, Tina. Hey, your age has nothing to do with you. Hey, I didn't become a nurse until I was like 32, 33. It don't got there's people that became nurses in my program that were like 50, 61 at one point, right? So it says going to my third semester next week. You good? You got it out there. Ordering tomorrow morning. Hey, get it. Get it tomorrow morning. Is it Denise Combs? How much? It's $48. You can go, like I said, if anybody wants to check out anything I have going on, you guys can check those links out in my bio. I'm actually working on a test taking strategy, like ebook or PDF that I want to give away for free to all of y'all that I've been working on for a little bit. I feel like it's pretty dense, and I feel like it pretty much kind of gets the point across. I think everybody would really like it. I'm 52 in my second semester. Shout out to you. Like Shondell, I don't know if you know, like based off of your picture, you look kind of like Nurse Alice. Like, and if you don't know who Nurse Alice is, you can look her up. You kind of look like Nurse Alice. She's like she's like a nursing correspondent for like MSNBC. And she lives like out of California, and I think like the LA area. That's kind of who you look like when I see your picture. I'm about to get it just in case. At this point, I've spent so much money. Should just keep going. Hey, here's the thing. Once you become a nurse, you're gonna realize how much money you're gonna spend. Like how much money you're gonna spend on the back end. Third NCLEX attempt next week. That's what I'm talking about. Hey, third NCLEX attempt. Hope we always are going and striving for a pass. So you got my support. You got my love. You got everything that you need for you to conquer that exam, right? And taking the NCLEX, it's not about just passing, y'all. It's about conquering, right? You conquer it. Like you can't just wake up one day and be like, oh, I'm gonna go take the NCLEX. Nope. You got to go through the process of becoming a nurse. But first, you got to get into nursing school. How do you do that? You got to do all the prereqs. You got to do the entrance exam. Then once you're in, you got to go through the humble phases of fucking the first semester. You know what I mean? You got to get through that. And you got to go through all the trials, the cries, the broken relationships, and then you eventually graduate. The exit HESIs or the exit ATIs, like you got to do all that shit. And then you finally got to take the exam. And then when you don't just pass it, you conquer it. Because you got to go through all that endurance in order for you to get there. All right. So you don't just pass it, you conquer it. All right. Remember, we are unsuccessfully successful around here. All right. Bar none. Let me see what we got. It says, hey, y'all, I just wanted to say I passed my catheter skills. Shout out to you, Leslie. Shout out to you. I botched an IV today and clinicals today, and I feel a little discouraged. Steph, in order for you to get better, you got to practice. Third NCLEX test taker as well. Oh, I'm tracking. I got you. I'm picking up what you're putting down. Can I please get help with study strategies for med-surg? So one thing I'll tell you is a Tamiya. The one thing that you should do, get into a small group, 3 other people, 25% of it broken up, right? You do 25% of the work. They do the other 25, add up to 100%. So you doing 25% of the work. Get you 100% of the benefit of that, right? Find you a good group of people to do that with. That's how I got through med-surg. I swear to you. And the moment that I was just like, oh, I did it every semester and I didn't fail anything after that. Can you recommend RN online programs, please? There's tons out there. I know one is Western Governors University, and I think Capella's another one. But depending on what state that you live in, if they allow that, So you guys get this course. I just bought it and took a look at it. The course is undervalued. Ain't that something? Who's that? Blue Karma. Hold on. Did you just buy it? Because I think Blue Karma, what's your name? Because I see notifications popping up on here. Is it Karen? I think it's Karen. Karen, is it you? Yes, yeah. I literally see your name pop up here on my phone, and it's like, and I'm Karen. I'm putting more. I'm putting more stuff. Like you guys. Like if you see this paper right here, like this is all of my stuff. This is, and a lot of this stuff like ain't even in there yet. Like it's not even in there. It's not even in there yet. Like like based off of everything that I have on that piece of paper, there's going to be over 150 videos in there. Over 150. Over 150. So like if you're a person who just now started nursing school and you don't graduate for a year or 2 years, the flex that you're gonna have on people when you like, hey, I got an NCLEX course for $48. You're gonna be like, where? Well, I found this guy, I found him on TikTok. He updates it all the time, yada yada yada, blah 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 blah. Like it's crazy. It's crazy out here. It's crazy out here. And the new generation NCLEX review alone is 4 hours. Right? It's broken up into 8 sections, 30 minutes apiece. Because who the hell wants to sit in a review for hours, or better yet, go sit at somebody's or go to somebody's school and sit there for 3 days and cram all this information into where you get this massive headache, and then you're just like, well, fuck it. I hope I remember it. You see what I'm saying? Like I'm adding so much stuff in there. All right. It says, I can tell you it's undervalued and it's a lifetime access. Invaluable. Facts. Get mine, Sandy. Go get it. You know the deal, Sandy. We done already had this talk about that. LOL. I understand what you mean. Just looking up nursing. Alice. You see what I'm saying, right? It says, Tamia says, these girls are awful in my cohort. I just need Jesus. And thank you for the advice. All right. So here's the thing, Tamia. Another thing I recommend, get into a Facebook group. Hey, by the way, when you join the 7-day NCLEX course, you guys get into that private Facebook group, right? You get into that group and you guys can converse amongst one another. You guys can post in there. You guys can do whatever you want. You know what I'm saying? I'm trying to foster that environment to where it's better for you guys, right? Kind of get out all the fluff and all the nonsense from people. I went to Nightingale College. That's on. Okay. Somebody asked me about that and I was like, I've never been there. So it says, can you explain how your website is set up? Do you pay month? It's a one-time payment, Nikki. One-time payment of $48. That is the bonus for getting into the pre-launch. It's a pre-launch special. So you pay it one time. I'm telling you right now, I will eventually go to subscription, but the subscription's not happening right now. I'm going to look at it for sure. Yeah, go check it out. The link is in my bio. It is labeled the 7-day NCLEX course. Right under it, it says NCLEX one-on-one coaching. If you're looking for that private, one-on-ones, we go over. We have our private sessions. We go over NCLEX style questions together. We talk about motivation. You get a tracker. You get a calendar. We talk about content areas that you need to focus on. You get my phone number. You get all that stuff. So it says, what's your take on the 30U in option in Cali? Carrie, elaborate for that. You're talking about like the 30U. What is that? I may not have heard that. How much is the 7-day? It's $48. $48. You can go over there, check it out. The link is in my bio. The 48 unit option. What is that? You got to give me some more context. Hey, if you guys are new here, welcome. We did NCLEX questions for about an hour and 15 minutes, right? We do that every Monday, Wednesday, and Fridays. Make sure you guys like, share, and follow, because I do that every 3 days for y'all, because I want y'all to definitely get something out of that. And so I also want to know who you are, where you're from, and where you're at in your nursing journey. Solo or Solo. I'm sorry. Thank you for the share. Y'all keep sharing. But what other questions do you guys have? Yeah. Hey, so I've been in the Navy for 16 years. 16 years. I hit 16 years in September. I'm on the downward slope. I've been an instructor for going on 8 years. It'll be 8 years in January. I was a surgical technology instructor for 3.5 years. I was also the clinical coordinator for that program. I was a trauma nurse. I am a trauma nurse instructor, as well as I taught tactical combat casualty care in the Navy, and I taught advanced burns. I taught ACLS. I taught pre-hospital trauma. So I have it's weird to say, but I have almost 10 years of teaching experience. So that's why I love to do this. I can't teach formally because nobody's called me back yet, but I can't teach formally. So this is the way that I can teach and I can give back to people. This is what I thoroughly love doing, going back to school to get my master's in education, and then maybe get my doctorate. It just depends on how I feel. I'm tuned in. Hey, what's up, Taylor? Taylor, you missed the NCLEX questions. By the way, every live that I do, it goes up on YouTube. Okay, so if you miss it or if anybody else misses it, just shoot them over that way. My YouTube is the Boot Nurse. Every social media platform that I have, it is the Boot Nurse. So TikTok, Instagram, Facebook, what's the other one? Twitter, Thread, OnlyFans, all of it. Yep. Anyways, it says, TT says, what advice do you have for someone doing a health assessment practical exam in the next few weeks? Practice. Go A. So I know that you guys have a checklist, right, of the things that you need to do. And they have starred items that if you don't do them, it's essentially an automatic failure. You need to find you a human specimen or you need to get you a mannequin. I don't care if you need to wrap up pillows and lean them up against a couch, whatever. You go down your checklist and then you memorize it. If you go down your checklist and you memorize it, so if we're doing our head-to-toe assessment, I'm going to be checking for anything that's going on up here. I'm going to see if they have any lacerations. I want to check their eyes. Hey, sir or ma'am, how are you? Hey, sir or ma'am, my name is Kevin. I'm going to be your nurse today. Hey, is there anything I can help you with today? And then, boom, if somebody asks you a question or if they respond to your question, you already know your assessment right there for airway, breathing, and circulation is already happening. Right? So you can kill so many birds with one stone just by opening your mouth and asking them a question, right? But you can never, ever, ever go wrong. Ever go wrong if you go off of that check sheet, okay? It's the LVN to RN 30-unit option where you can finish and challenge. Oh, I see what you're saying. So you're talking about inside, like you're in an RN program, and essentially when you get to a specific point, you can challenge the LVN board in the state of California to at least be a nurse at the LVN or LPN status. Okay, so I have heard of that. Now that makes more sense because you give me more context. So, so I think it's okay. I think it's okay because it allows, so essentially you're setting another milestone for yourself. You get halfway through the program, at least you know that you can become an LVN. And then, heaven forbid something happens and then, you have to drop out of school. At least, you got the LVN aspect, right? But then, what if you want to start working as a nurse, while you're in school? That option is also there for you. In the military community, if you are a corpsman or you're an Air Force med tech or an Army medical person or whatever, you can do the same thing in the state of California, but your on-the-job training will suffice for you to go sit and challenge that board in the state of California. I think North Carolina is another one that you can do that as well. So I think it's okay. I don't think it's bad. I feel like 7 days is not enough to pack info in at all. In the 7-day challenge, how long is each day? So it's on demand, Chastity. Okay, so it's on demand. You can do it as much as you want. Now, here's what I'll tell you. I don't know exactly where you are in your NCLEX journey when it comes for studying, but any other type of review that you try to go to, it's 3 days, right? I've done a Mark Klimic one. I've done Kaplan. I've done Hearst, and they did it over the span of a weekend. And those were the longest drawn out days that I've ever felt, right? So what I thought to myself was, why can't I expand it, but make it a little bit, why can't I expand it, right? And remember, I used to teach, so that I found out all different ways to find out how people can accumulate and acquire the knowledge. Been studying since November 1st. I test in December. Okay, so the whole point is so it doesn't take out from the rest of your day from studying, right? So management of care. Right now, that is slated to be about a 2-hour long video, which is separated into, 4 sections, right? So 2 hours of you learning about management of care, the type of questions that it has, and the familiarity, obviously I can't talk, but being familiar about what you see and then being able to recreate that when you go and do your questions. I think that would suffice, right? And plus you can go back and look at it as much as you want. And then the next day you can go and you can do pharmacology. And the reason why I have those 3 days first is because they are the largest sections of the exam. You know what I mean? So hopefully that could clear it up. And here's the thing, 7 days is a lot better than 3. And the 7 days is to allow a longer time for absorption. Think about it like heparin and warfarin, right? Heparin is fast, but warfarin, it takes like about a week for it to finally take effect. I like the warfarin effect, right? Where you can just kind of like just let it go on, and then it simmers and then it gets used to being in there, and then you're able to retain it a lot longer. Okay, so I hope that answered your question. I was trying to articulate it as best as I can, but that's my thought process of making it a little bit longer. And of course, it's on demand, right? I know at some point, eventually, I'm going to do a live review. But right now, with me getting the course up, maybe sometime next year, I'll do a live review and see how people feel about that. Can you challenge the board DE? Is that Delaware? I don't know. I don't know if you can. That's a quick Google search will tell you that. It says a lot of people saying you can't prepare for a test like this. You could study over subjects and test none. So I don't know how. Is it no net? No, I don't know how to pronounce your name. I'm gonna fuck it up. But whoever told you that is lying, because you can prepare for this exam. And what they're meaning is that you can't memorize on this exam. It is about being familiar. Like, you need to know what the processes are. I should be able to give you a question, and you should be able to go through the systematic approach and the processes of how to answer this question based off of clinical thinking or critical thinking and clinical judgment. You need to be able to know where things can go. And if they go that direction, you need to be able to make a firm decision on what your next move is going to be, AKA your answer to the question. So, okay, I'm confused. I went over and looked at the link. It says 7 days, but you're saying it's good for life. So the name of it is 7 days, Jackie. It says it on there that it's for life. So over the course, and I just explained it, over the course of 7 days. That's it, over the course of 7 days. I'm not saying you get it for 7 days. You get it for life. It says it right there. There you go. I'm an LVN of 15 years. Okay. But they offer a 30 units step up for LVNs to become RNs and challenge. Okay. That makes more sense. Because figured as soon as I'm done with this program, I'll switch to yours for 7 days. Cool. Before I take it. Okay. I got it. Do I always have to sign in, via TikTok to study? No. You should, when you signed in, like, you should get a thank you email, and the thank you email will take you directly to where you're supposed to go. Right. Thanks for the thanks. That helped their logics. You answered after you went. Oh, okay. I got you, Jack. Hey, so the questions, not the questions, but the comments, they didn't cycle all the way through. So I'm just like, well, hopefully I answered it. So I have to keep scrolling. But you're welcome. Okay, I got it. But yeah, you don't. Yeah. So Sandy, you don't have to do it that way. But what other questions you guys have? Anybody interested in anything else? We got a bunch of stuff that's going on. Like I said, I have some PDFs that's going out. By the way, another gift that I'm going to be giving to people is I am making an ebook, and everybody that's a part of the pre-launch right now is going to get that ebook. That ebook is going to be dense. It's going to be dense of the things that, that I would recommend looking into, right? The ebook, of course, is not going to give you all the answers. That requires you to do a little bit more research if you need it. But I'm telling you, it gives you a good head start. Carrie says, is this an NCLEX prep course? Is it online? I'm in Cali. So it is an NCLEX prep course, Carrie, and it is online, but it's not in California. Well, technically it is in California because you can do it whatever, but it is online, 100%. I'm so ready to study. Thank you so much, Sandy. Hey, you've been here long enough, Sandy. So I ain't about the games. You know what we're about around here. So, what else? What other questions you guys got? If you guys are new here, welcome. We do NCLEX questions at the first half of our stream, so to speak. And we did those. We do it for about an hour and a half. I got those questions off nurseslabs.com. Will it work for passing the NCLEX in Canada? So people that live in Canada, as well as the United States, take the same NCLEX. As a matter of fact, I actually am about to start coaching a young lady from Canada. I've coached people from Canada, from Africa, from Jamaica, Puerto Rico. One young lady who lived all the way in the Philippines, mostly, of course, here in the United States. But I've coached all around. I've been coaching for 3 years, y'all. The moment I became a coach, you're in Ontario, yeah, it's still in Canada. Right. But I've been coaching for 3 years, y'all. The moment that I became a nurse, I said to myself, I never want anybody to feel how I felt. Right. I never want anybody to feel like they're a failure, that they can't do this. And I don't like and with direction, they can go out there and conquer. I don't just say pass. I say conquer. I'll say conquer it. You conquer it. You don't just pass an NCLEX exam. Right. Like I said, it's a journey. It's a journey for you to get to the top of that mountain of getting your license, and you can hold it high above your head. Right. And then you realize you're at the summit of another mountain. Right. But hey, that's just part of how it goes. Right. So you're in Ontario. So shout out to you. I've never been to Canada. Right. But I've always wanted to go to Canada. So nice. Good job. Appreciate you, Summer. Hey, so for all 58 of you guys, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. If you guys got any questions about nursing, NCLEX, first year nursing. Do I got any nurses that have been nurses for a while? I had a bunch of folks that came through here And, I usually get nurses that have been nurses 20, 30, 40 years, that can shed a lot of wisdom on here, right? So also, if you guys take your NCLEX and you pass, come over here and tell us. Come over here and tell us so I can give y'all all the love. Hi from the Burn ICU. What's up? Hold on. That name looks real familiar. That face looks familiar too. Hey, ma'am, I remember you. Remember that one time that I Venmo'd you money so you can get us Thai food? Hey, as a matter of fact, I think I saw your sister at the hospital. I think I ran into your sister at the hospital. So I think that's really funny. I just remember you because you were so polite to me when the first time that you precepted me. Checking in from Georgia. I'm almost done with my first semester of the LP and the RN program. Shout out to you. I'm new from Maine and graduate in June nursing. Shout out to you, Jamie. Nicoselli. There it is. Yeah, I'm from Kenya, working in the ICU, but to do that NCLEX is very complicated. It can be very complicated for sure. Hello. This is Zakia from San Francisco. I'm in my first 2 weeks of nursing school. Hey, I bet you're getting humbled, huh? 100% that creative chocolate diva getting humbled out there. But Nicoselli, I remember I saw her in the cafeteria. That's where I saw her. And I was just like, yeah, I know her. She ordered Thai food from one day when she was precepting me. So shout out to you. I didn't even think I was just talking about the burn center as well. I talk about how when I worked there, and not you specifically, but remember Force, right? And all those other folks that were over there. So shout out to everybody. Hey, I just want to let everybody know, like when I worked ICU, I loved it. Like I loved when I worked the burn ICU. That's funny you're doing. I appreciate it. I don't do ICU anymore. I do OR now. But yeah. So is Miss Monica still the manager up there running stuff? Yeah, he is in CRNA school. I know. He and I talk about. I talked to Eric not too long ago. So now I'm over here having a full blown conversation with somebody. But shout out to all y'all that are in here. I appreciate all the likes and all the love that you guys are giving. I just think that's great that somebody that knew me is just like, hey, I remember you. Yeah, man, the burn center, burn ICU was great. My first experience as a nurse, and it was awesome. Definitely awesome. So what other questions do you guys got before me and Nicoselli freaking start having a whole full-blown conversation and taking away from everybody? But yeah, we do NCLEX questions here. We do TikTok lives every Monday, Wednesday, and Friday at 5:30 Central Standard Time, aka Texas time, because that's the only time that matters. So shout out to y'all. But of course, I always want to know who you guys are, where you're from, where you're at in your nursing journey, and what questions do you guys have. Also, if you guys are interested, I have an NCLEX course, the 7-day NCLEX course. That link is in my bio. It is currently going for $48. $48, y'all. And the price is going up on Black Friday. I know, backwards, but hey, it's super dense. There's a bunch of stuff. There's a bunch of folks in here that already bought it today. And they were just like, that is ridiculous. And you're about to get a max. There's going to be over 150 videos in there, y'all. And I'm the one who's doing all of them. So you're going to see this glorious face along with my glorious face inside of the program itself. So Jamie says, so as going in as a new nurse, do you think we should start particularly in an area like OR, ER? Jamie, you can go wherever you want. What a lot of people will tell you is they'll tell you to start med surg. But, we're in a time in nursing to where we ain't got to do that. Right. But then there's certain places in nursing where they do require you to have at least a year experience before you go there, like labor and delivery. Right. But they have programs like, residency programs where you can go and you can work. Like you can be an ER resident. You can be an OR resident. Like they have residency programs for you to go straight into them. My recommendation as well is to go to a level 1 trauma facility and work. Right. What is your name on YouTube? My name on YouTube is The Boot Nurse. So everything, YouTube, Instagram, of course, TikTok, Facebook, everything is at The Boot Nurse. I'm so interested in wound care. So if you want to do wound care, my opinion is you would want to go to med-surg. Because if you go to med-surg, you do a lot of dressing changes there. And you get to definitely not hang out, but you can shadow the wound ostomy nurses for sure. I would definitely go to med-surg for you to get your wound care experience if you want to go be a wound ostomy nurse. Also, I learned a lot about wound care from the LVNs when I worked in the burn center. Like everybody in the burn center gets a bath, right? Right? And I'm telling you right now, that's wild. And I'm telling you, man, like The acuity of patients that are in a burn center are wild. They're still wild to me. I remember one day they asked me to coordinate the shower schedule for the whole floor. Yeah, that was hard. That was hard, but we made it work though. We made it work. Digital designer, what do you do or what to do when I graduated 2018, failed twice, and haven't done anything since, but I want to go back? All right, digital designer. So I failed my NCLEX in 2018. I passed it in 2018. I've been a nurse for 3.5 years now. So my question to you is, what's the problem? So my question to you is, what is the problem? My second question to you is, you want to know what to do is to get that ass up. Don't feel sorry for yourself. Stop feeling sorry for yourself and put in the work. You need to figure out where you went wrong. Look at your performance sheet, where you went wrong, and you need to improve upon it. So if you didn't do well at maternity, cool. Grab that piece of paper, go to maternity, find out maternity stuff that you need, and start hitting it, right? Put yourself on a schedule, recreate the testing center, keep yourself around people that you want to be like. If you need tutoring or coaching, you can go find you a tutor or a coach or a mentor. I do that as well. Practice, practice, practice. That's what it takes. That's what it takes. Is there a review course? I have a review course. I do. Yeah. So my review course is the 7-day NCLEX course. That link is in my bio. It's going for $48. I also have a new generation NCLEX review. It's a specific new generation. So we go over like 100 questions. I read the question. We talk about topics. I break down the rationales. You hear it all. Right? A lot of people like it so far. I haven't heard anything really relatively bad about it. A lot of people like it. So go over there. You can go over there and check that out. And if you're also looking for coaching, I also do coaching as well. Right? And by coaching, I mean one-on-one tutoring where you can get, the private setting, ask your questions. We come up with a game plan for you, certain things that you need to learn. It's a mindset shift. It's a mindset shift for sure. It's definitely a mindset shift because I'm telling you right now, nursing school doesn't teach you how to pass the NCLEX, right? Nursing school teaches you how to graduate. And then you happen to just learn how to freaking take the NCLEX. But then you really learn how to become a nurse the moment that you step on a floor. And you get humbled real quick. I'm telling you right now, when you get to an ICU, you get humbled real quick, right? But it's definitely a learning phase. And everybody that's a brand new nurse here, you guys are going to go through the imposter phase. You guys are going to go through that. You're going to have imposter syndrome. I don't belong here. Yada, yada, yada. Trust and believe me. When I first started working as a nurse, by third week, I felt it. First month, second month, third month. And then by the time I got to the third month, I started feeling comfortable. And then, I got to the fourth or fifth month, I started feeling more comfortable. It usually takes anywhere from like 6 months to a year for you to start to find your area of comfort working as a nurse. It happens. It's just a part of how it goes. All right. So, well, what's up, everybody? How are y'all doing? I was going to get off here at 7:30, but I think I'll hang out, see what other questions you guys have. If you guys have any questions, make sure you guys drop them down there. Also, I want to know who you are, where you're from, where you're at in your nursing journey, and what questions you guys have. User 21 says, great advice. I appreciate it. That's something that I had to learn. I learned it on my own. And then I had some good mentors along the way that told me, hey, it's okay. This is what you're going to feel. This is, it's very, very normal. If you have anybody that's out there that's trying to tell you that, no, it's not like that, they're full of shit. So I don't know if it's raining outside or if somebody just flushed the toilet, but it sounds loud as hell up in here. But yeah, what else do you guys got? Hey, also, like I said, what ideas, what do you guys, for those that are inside of the 7-day NCLEX course, which is $48, by the way, that link is in my bio. What else? What do you guys want to see? Like, I have a whole curriculum. Like, I'm working on peds, I'm working on maternity, working on psych, working on safety videos. I'm also working on, NCLEX mindset videos, all kinds of stuff. So like, if you guys have any suggestions, I'm definitely open to them. Shout out to Jason. I see you out there, big dog. So yeah, if you guys have any questions or comments or suggestions about those, then, we can ask them. You guys can definitely ask them for sure. If you guys are new here, we did NCLEX questions. We do NCLEX questions every Monday, Wednesday, and Friday at 5:30 Central Standard Time, Texas time, because that's the only time that matters. And then we also do an Ask Me Anything after that. So essentially, if you're a nurse, you guys can ask me that. So just got off shift and still doing homework. Hey, my man's always doing homework. Hey, That's what it takes. That's what it takes. Do you do dimensional analysis or other routes for math? I'm not good in dimensional analysis. So Jackie, in order for you to get better at any type of math is practicing. Like you have to follow the formula, find you example questions, and you just have to do them. I don't know any tricks in regards to math like that. I don't know any tricks. Like you just have to practice. It's practice for sure. So, and if you're not good, you got to get good. User 21, it says, what can we look forward to when we purchase your book? So, inside of this, like PDF or ebook, whatever you want to call it, it's going to be like a big document, but, it's going to talk about, test strategies, important sections that you need to know on NCLEX. So, there's going to be a pharmacology section, there's going to be, talking about prioritization, delegation, so it's essentially going to be like an ebook of like, if you want to like try to take it on the go, or if you want to read it on the toilet, like you can do that, you know what I mean? But then again, the phone is your new newspaper, so you can just essentially do it that way. But, you can print it out, you can essentially do whatever you want with it. But it's going to be pretty dense. It's going to cover, a lot of other subjects, in regards to understanding like NCLEX material. And then even if you like something that you couldn't think of, and you're like, oh shit, maybe I should look that up, and you can go, do further research for yourself. Can you explain the 7-day NCLEX? So the 7-day NCLEX course, the 7 days it takes away from doing. So think about it. When you guys do an NCLEX course, or anybody that can attest to this, if you've ever done an NCLEX course, they're usually over 3 days. So like Kaplan, Hearst, Mark Klimick, and any of those other ones, they do it over a span of 3 days. I know, being an instructor, that a lot of people want more time. They want more time in order for them to essentially let things sink in for themselves. So I decided, let me spread this review out over 7 days, right? So it's spread out over 7 days, and you do one major section per day for a couple of hours, right? So first section would be management of care, right? So we go over management of care, what it entails, and then we go right into the questions, the Q&A. We do talk about the topic, what to look for if you need to go into some more content to understand that, as well as going over the rationales of why the questions are right, why they're wrong, so on and so forth. Okay. And it's done it's essentially over a 7-day period, although it is on demand. So if you decide you want to do management of care and pharmacology in one day, it is your prerogative. However, the program itself is not set up that way. That's why you'll see, it'll say day 1, it'll say day 2, day 3, so on and so forth. What's up, Stacy? How are you? What is this? It says, I graduate nursing school soon. Any study tips for NCLEX? Recreate the testing center, eliminate all your distractions, put yourself on a calendar, put yourself on a study schedule, maintain your time management, and start with the hardest section that you have difficulty with. So mine was pharmacology. So I started with pharm. I looked at almost every pharm video that I possibly could before I moved on to the next section. Right. But I also still incorporated doing quizzes, as well as with those quizzes or readiness assessments or whatever, into rationales. OK, and this is what I recommend. I hate fucking doing questions, answers, and rationales every single day. So what I did 85, or back in the day, it was 75 to 150 questions every other day. So that allowed for me to do 75 questions, give myself a break, and then go right into the rationales. The next day, wouldn't do it. I would just look at content. You should be looking at content every day. Every day you should be looking at content, because all content is videos, or it's reading, or whatever you want to do, right? Content every day. I need somebody to put down there every day, like put every day down there in the comments, so I know that you're picking up what I'm putting down. But questions every other day, questions every other day, content every day. And if you do the math, that means you would have done at least like anywhere from 1,100 to 2,000 questions within a 6-week period. You see what I'm saying? So do the math. So that's why it's expanded over the way that it is. Okay. Hopefully that makes sense. Do you recommend taking the NCLEX right after school, or give it time? Take it right after school. You want to know why? You take it right after school is because your mind is still fresh with all of that information right out of school, believe it or not. You want to take it as fast as possible, because the longer you go, the less you'll retain, because you're going to stop thinking about it. You're like, oh, fuck that test. I'm going, it's hot girl summer. You want to go wherever you want to go. You know what I'm saying? You ain't going to be thinking about that. So it's better to get it over and done with now, so you don't have to think about it later. All right. Prepare for it now, so you don't have, the chances of you doing it later are low. Prepare for it, get it done, over with, pass, and then go on about your day. right? You don't want to sit there wanting to linger and be like, oh shit, I got to go take the exam. You know what I mean? So I hope, Jamie, hopefully that answers your question. Stacy, I'm good. You know how we do around here. I'm actually about to get off here in a little bit. I've been on here, almost 2 hours? No, over 2 hours now. So you already know how I do. Shout out to all 50 of y'all in here. Yes, great advice. You're welcome, ma'am. You're welcome. Hopefully hey, if you guys are finding value or have found value in anything that I've been talking about, make sure you guys smash that like button. Give me all that love. Give me all that love. What other questions do you guys got? What other questions do you guys have? Like I said, I'm going to be making a PDF, and I'm going to be for right now, like I said, everybody that is inside of the course right now will get that PDF for free. You're going to get that PDF for free. Because once again, that's just another thing that I'm adding value to this, right? But then once it's done, I'm only going to send it out once. I'm only sending it out once. So if you're not inside the program by the time I send it out, then, you ain't getting it, I guess. So, hey, if you guys are new here, welcome. My name is Kevin. I've been a nurse for 3.5 years. I've worked in the burn center. I've worked in burn center in the burn ICU specifically, as well as a neuro and a medical ICU. I've worked in PACU, and I've also worked in the operating room. Took my NCLEX 3 times. Passed it on my 4th time. Nobody cares how many times you've taken the exam. Nobody cares. Nobody cares. No one cares. All right. So you should stop caring. And if you failed it, you need to audit yourself, trim the fat, and turn around and go for another attempt. That's what you need to do. No job is going to come up to you and be like, "Ugh, bitch, you failed." Like, ain't nobody gonna do that. No one's gonna do that, right? No one's gonna do that, right? And here's another thing: if you work in a patient care area, right, and people know that you are taking your NCLEX and you fail it and they're rude to you, leave that area. I'll give you an example. There's one young lady I was coaching who failed twice. And when her coworkers found out, aka the nurses that were on her floor, they started being really rude and mean to her. Granted, I don't know all the aspects of that story, but they were mean to her. And I told her, I was like, you need to switch. You don't need to work there, because now you're in a hostile working environment and they're essentially making fun of you for an exam that most definitely is very difficult. Right. But the great thing about the exam now is that the exam is from the third quarter numbers, 87%. Last year, it was in the 70s, like 79%. So that's a huge jump, huge jump, right? But yeah, so shout out to everybody that's here. One last thing I want to say before I get off here. If you're a nursing student, or if you are in nursing school, or if you're taking NCLEX, you need to change your mindset. I'm an LPN student. Can I benefit from your book? Absolutely. Hey, so here's the biggest thing that's different about LPNs and RNs. The only thing that's different is your scope of practice. The content that you learn is the same. All of it is the same, right? But you need to know who you can and can't accept. You need to know what your roles and responsibilities are. And you need to know like what you can do, like what type of sterile things you can do, so on and so forth. Other than that, that's it. Like everything else is the same. Like, that you can't do IV meds. You know what I'm saying? You know that you can't do first assessment. You know that you can't take stable patients. You know that you can't do blood transfusions. But everything else is the same. Like, but you still have to know the same content I have to know. You have to know about, like, can you monitor somebody getting blood transfusion? Yes, but can you do anything in regards to administering it? No. So if you see somebody like, hey, yeah, he's looking kind of weird. Oh, here I come. Like, you assessed him secondary to my assessment. And then I got to go and I got to reassess. Hey, Mr. or Mrs. So-and-so, are you okay? No, blah, blah, blah. All right, well, let me discontinue. That's how it goes, right? And and so the book will benefit you, as well as the 7-day NCLEX course will benefit you as well. Okay. Remember, I said it's all about your roles and responsibilities, what you can and can't do, who you can and can't accept. That's it. That's all that's different. So, but yeah, mindset. I had somebody come into my one of my DMs or my inboxes and tell me that they really want to pass the NCLEX, but they don't want to give other people money to do it. And I was just like, okay. So that's your prerogative. That's your prerogative if you don't want to give people money. But I want to give a lot of people perspective. A lot of people say, it's like, I don't want to spend money. I was like, but you just spent anywhere from $20, $30, $40, $50, $100,000 for you to go to a nursing school, right? So you say you spent it, or did you invest it? There's a very big difference between spending money and investing it. And I want people to understand that. right? We spend money on frivolous ass things, but the moment that you need to invest in yourself for something, all of a sudden it's not going to work for you. Granted, always do your research before you purchase anything that you consider as an investment for yourself. That's everything. My course, which is why I love you guys asking me questions so I can give you, so I can respond back to it. Real estate, cars, houses, gardening, whatever it is, right? But it has to be a mindset. Going forward in the nursing realm, everything has to be an investment because you are investing on expanding your knowledge from being someone who knows nothing, aka a boot ass nurse, to expanding your knowledge, going up the nursing, ladder. It could be everything from advancing your patient care to advancing your nursing knowledge, by getting a different degree, being in a leadership position, all that stuff, right? So if you want to become a nurse, you got to realize that it's not about spending money. It's about investing money, and you invest it in yourself. So always think about that when it comes to purchasing anything. So hopefully I'm not over here just blowing smoke up everybody's ass, giving you guys some real good information. If you guys are really taking value to this, make sure you guys smash that like button. So what other questions do you guys have? Also, if you guys are new here, welcome. We did NCLEX questions as well as we're doing Ask Me Anything to follow that. So right now I'm just answering questions as little as they may be trickling in here. Today is Wednesday, so I know it's hump day and people are just like, I got to go. But I want to know who you are, where you're from, and where you are at in your nursing journey, right? That's what I want to know. Another shameless plug, if you are looking for an NCLEX course, that it is for a lifetime, it is on demand, it is for both RN and LPN, and it's for $48. Check out that link in my bio labeled the 7-day NCLEX course. It is for $48 for the next 8 days. So you guys can go over there and check that out. As well as if you are somebody who's struggling with the NCLEX and you want one-on-one coaching, essentially we do this, but, on a private setting, we break down questions together. We come up with a calendar and a tracker, accountability, which is super, super, super huge. And in areas where you need to focus and, going through all kinds of just other things to advance your knowledge. You guys can check that link out too. That link is also in my bio labeled the NCLEX coaching and mentoring. All right. So what questions do you guys have? What you guys got? What you guys got for me? If you guys don't got any other questions, then, hey, your boy can get off and just go, beat up his son. I'm just kidding. I'm not going to beat up my son. But yeah, what other questions do you guys have? Hey, we were talking nursing. That's what we're talking about. Ask me anything for nursing. I had one young lady come up in here who was one of my precepting nurses when I worked inside of the burn ICU. Definitely did not think that she would jump on here. So Nick Selly, thank you for coming up in here and entertaining me, so to speak. Is NCLEX online, or do they vary from state to state? Christine, that's a good question. The NCLEX is an exam. It is a national exam. So it does not vary from state to state. However, you can take the exam in any state. So if you live in New York and let's just say there wasn't a testing center available, but the closest one was Kentucky, you could schedule your exam to go take it in Kentucky. But it is a national standardized exam that you can take in any state. Hopefully, I hope that answered your question. What else you got? What else do you got? Let's see. Usually I would turn on some music, but I don't know what music is allowed and not allowed because I put something up on YouTube and it got copyrighted. So I'm just like, damn. Maybe I should just start finding out all kinds of other things. But real quick, I'm gonna do this one last time, show you guys what the website looks like. So that way give a little bit of clarity for some people. All right, I'm gonna turn this thing around. Here we go. All right, y'all. So this right here is the website for the 7-day NCLEX course. It's a little small because, obviously for reasons, right? So the 7-day NCLEX course is Conquer Your NCLEX in 7 days, right? And by 7 days, that means within 7 days, we go over the majority of the things that you need to know in order to conquer your NCLEX. So we break down the 8 sections of the client need. So management of care, pharmacology, pathophysiological adaptation, reduction of risk potential, so on and so forth, right? And yes, you are not reading that right. That is for $48. $48 you can get an NCLEX course, right? And it's in its pre-launch phase. And so early adopters, that's what you get. You get that, and you get it for a lifetime. Yes, and it says a lifetime right there, okay? And so here are a couple of testimonies, and this is what you'll learn. You'll learn NCLEX mindset. You'll learn the NCLEX structure, talk about critical thinking, and then we roll into the review, talking about pharmacology, management of care, physiological adaptation, and as well, what to expect when you guys go and take the actual exam. This is the curriculum that's laid out, right? Have a little welcome video, all that good jazz. I talk about my success story. I'm actually going to be putting that video up soon. But then the most biggest and important thing is here's the review right here. We have this the 7 day, right? So over 7 days, and then there's actual already a new generation NCLEX review that's already in there, right? And then here is the curriculum. Here, I'll bring that back. So here's the curriculum. I have 18 videos, y'all. 18 videos in pharmacology. Pharmacology videos are at 18 videos right now, and I'm actually going to put some more in there too. And so this is what is included. Like you graduate or you take the test, you fail it or whatever, you need help, you're confused, you need direction. That's what the NCLEX course gets you. All right. I failed my exam 3 times and spent over $3,000. So y'all don't have to, right? I don't want y'all to have to do that. You get to be a part of a Facebook community as well. This is my little, I wish Nicoselli was here so she could see this picture. But yeah, this is when I was at the Burn Center. A little bit of synopsis about me. And then, of course, who the course is for. You know, you want to kickstart your nursing career by getting your license, right? You value the time and you value yourself and you want to invest. And then here's a couple of testimonies. Also, you can find these testimonies on my YouTube channel as well as on TikTok and on Instagram, right? And there's a couple of other testimonies from people where I helped them pass, right? Frequently asked questions. And it says, how long is access? How does a lifetime access to the course sound? That's what you get also for LPNs and LVNs, okay? So it's there. And it says it's in its pre-launch phase, which means we're updating stuff. So is it complete? The answer is no, it's not complete, but there's enough in there to warrant, you to get it. And then we go over NCLEX style stuff, right? There's NCLEX style questions where we go over in regards to the new generation NCLEX review, okay? And then also right here is the actual course, right? If you guys look over towards the left, which I'll bring over here, you guys can see the curriculum layout. Sorry if that's too bright, okay? So let's go over here. So like I said, it should look familiar, right? These are all the videos that are up inside the course. If you guys are looking for this course, that course is in my bio. It is labeled the 7-day NCLEX course. It is going for $48, right? And so we talk about answering NCLEX style questions, critical thinking, the rules on the NCLEX. And then right here, there are 8 parts of the path to conquer the NGN, right? And that's this video right here. Right. And if that looks familiar, that looks like a bow tie. Right. Because they have bow tie types of questions that are on the NCLEX. Right. And then we go and they have select all that apply questions. And then we have multiple choice. Here's another bow tie question to look out for. Right. And then more, so on and so forth. Right. And then in section 8, we'll say section 8 video, right, which is 25 minutes long. We go through, we go through the back end, right? I tell you a couple of things, how to evaluate, right? And then we go over memory tricks, talk about what you can and can't do, right? We also go over, prioritization, EKGs, cardiomyopathy. We go over anticoagulants, antiplatelets. We go over respiratory. Those are little quick memory things to look out for, as well as labs, right? And then, of course, there's a nice thank you, but then there's a quote that's somewhere in here, right? So I always like to do quotes, so hopefully that'll be super helpful for anybody that is looking for that, all right? And that link is in my bio. So with that being said, ladies and gentlemen, are there any other questions? Is there any questions from anybody that is on here in regards to NCLEX, the 7-day NCLEX course, one-on-one coaching, anything of the sort? What are we thinking? What are we thinking? Appreciate all the likes and all the love. Y'all got me to 30,000 likes today, so I super appreciate that. Really, really, really do appreciate that. All right, cool. Well, since you guys don't have any questions, I like to say this. I say this all the time before I get off, but be kind to yourself. You only got one you. You only got one you. So if you can't take care of you, you can't take care of nobody else. Not no spouse, not no kids, not no job. Damn sure not no job, right? So make sure you always take care of yourself. Physically, spiritually, mentally. Those are super important. All right. And of course, last shameless plug, if you guys are looking for an NCLEX course for $48 and it's for a lifetime for $48, that means don't go to Starbucks for a week. But I know some of y'all can't get rid of y'all Starbucks. You know what I'm saying? But check out the 7-day NCLEX course on demand. You get it for a lifetime for $48. That link is in my bio. You guys can go over there and check that out. Also, if you're looking for one-on-one personalized NCLEX coaching as well as mentoring, I do that as well. You can check that link out. It is also in my bio. So glad to have had a bunch of people up in here with me today. Hope everybody has a good rest of their week, and I will see everybody essentially, I was going to say bright and early, but 5:30 on Friday, where we will be doing some more NCLEX questions. So until then, bye.